man, if you are not getting morning wood, you are not getting morning erection, you are within 10 years of a heart attack. You are within 10 years of a stroke. That's not Dr. Abassi, that is research.
Fact.
A woman that starts her period late in life, 15, 16, has a less chance of developing what they call reproductive cancer, less chance of breast cancer, less chance of cervical cancer.
Are you serious?
I'm serious.
Wow.
Why? Men are ashamed to discuss their sexual incompetence. That in the bedroom, men who are doing well, they are supporting the family, they are professionally successful, but they can only do 2 minutes in the bedroom. So we're dealing with severe premature ejaculation. It's not a disease, it's a condition. Because the truth of the matter is, yes, women love money, but they love knacking past money.
You are sure of that?
I can tell. Look, so if you have been able to get her to the finish line, she's going to cook your best food for you. Your number will be on her speed dial because she knows you have something that most men are lacking.
No, this is a fact.
Men, generally, white, black, we feed off of variety. Your woman may be the most beautiful woman, but if they give you the second most beautiful, your body will perform. If they give you the third most beautiful, your body will perform. But if they limit you to only the most beautiful, after a while, there will be less and less performance.
Wow.
What you guys call see finish. See finish will enter. Well, for people who may be religious, so let me give it out there. We are sexual beings trying to live a spiritual life.
Let me read this message I got from a man.
Okay.
He said, I've given birth to 4 children and I'm done giving birth to children. I don't like my wife's pekus anymore. I prefer her ass, but she has refused to give me her ass. I like Anna. What do I do to get her to give me what I want?
Wow. The reason why when you don't last long is not beneficial to you and I is going to make you not to get the woman pregnant.
Don't last long, you get someone pregnant?
Yes.
Then how long then do you expect a man to last?
Good. Study also show, even though people don't want to talk about this, men with multiple wives, 2, 3 wives, live longer than men with 1 wife.
Seriously?
Absolutely.
Fact.
So
if I want to live longer, I should have more women.
Honestly.
People say more women kill than...
No. Don't talk to weak men. Let me explain. The younger the woman, the better the chance for you. A 17, 18-year-old girl, not Dr. Abassi, this is scientific fact. The egg that she's ovulating is healthier, stronger, better than the egg when she's 34, 35.
When you say healthier, stronger, what does it mean in childbirth? What is going to be the difference?
Less chance of her having less chance of her having
Whoa.
That is science.
Let me read this message I got from someone. The person say, please, I don't know how to handle this. Maybe help me to ask the doctor. I married a pastor and anytime we are making love, I'll be fantasizing with my other ex, or sometimes I will have to watch porn before I can be able to get turned on. And if I try to tell him that let us watch porn to make this thing happen, he looks at me like witchcraft. How can I be able to solve this thing? Because he's tempting me to cheat.
Wow, this is real. I'm very thankful for whoever wrote this. It takes a strong woman to say this.
What if the lifestyle most people call normal is quietly destroying their health, relationship, sexual health, and their future? In today's conversation, we're going to be dissecting most of the issues that people face when it comes to their sexual health and their relationship. And my guest here, an expert in men's health and cardiovascular issue, is going to be taking us through this conversation. So if you are new here, hit the subscribe button, like this video, and share it with those who will find this valuable. I remain your very host, Benzik. So make welcome my guest here, Dr. Rasheed Abassi.
Thank you so much.
Sir, it's a pleasure to see you today again.
The pleasure is all mine.
The first episode we had was quite very insightful. Most people highly benefited from that episode. Got a lot of people that reached out. They want to reach out to you to come over because of their health and sexual related issues. Quite very disturbing. In fact, the information I got from it made me to know that people are actually going through a lot regarding this kind of situation. But most of them don't usually talk about it. People usually try to hide it or just try to play around it. Now, let me start here. For you personally,
yes,
what are some of the most disturbing questions or things that you have personally seen people come to share with you secretly that you have handled? Let's start with men. Let's start with top 3 things that men usually come to discuss with you about, and then we can now come to the women.
Excellent. And thank you so much for the opportunity, because we're in a society where I believe, honestly, that we have lack of information. And Nigerian men, we're not different from European men. We're not different from Hispanic men. We need information. We need factual information, and then we can make better decisions. Unfortunately, we're in a society where we are medical desert and pharmaceutical desert. Those two affect a lot of our men. Now, add that to our cultural, religious hypocrisy. Honestly.
And
So when you are dealing with men's health, especially Nigerian men, we have to admit we're full of ego. Men worldwide, we have our ego to deal with, and then we have to deal with the stigma. So to answer the larger part of your question, the 3 most common things that I see that is shocking, and I keep, trying to make awareness to men that, look, you are not alone. I know what I mean by you are not alone. Most of us suffer from this thing. Men are ashamed to discuss their sexual incompetence. That in the bedroom, men who are doing well, they are supporting the family, they are professionally successful, but they can only do 2 minutes in the bedroom. So we're dealing with severe premature ejaculation.
Wow.
It's not a disease, it's a condition. And the fact that it's not a disease, it's a condition, more conditions are amenable to treatments. It's all about seeing the right professional, and they will tell you what you are doing that may be making your condition worse, and appropriately they can prescribe what you need to do to make it get better.
Yeah.
The second one is also contributing to our problem. Our problem in terms of fertility rate has gone down. Most couples are having sex the wrong time. So you're going to find out that the man, the woman only called the man, hey, come on, I'm ovulating. The moment you call a man like that, you have turned his body into a machine. It's going to fail. They're not actually doing sex for what it's meant to be. It's supposed to be pleasurable. Yes, there will be procreation that comes out of it. Not all of us will be able to procreate. It's a gift from God. But our men are having sex the wrong time. So it's a major issue when the man cannot do that. And lastly, which is a concern, most of our men are not getting it up in the morning.
That's morning erection.
Honestly. And don't take my word for it. Just follow the literature and look at the research. A man, white or black, if you are not getting morning wood, you are not getting morning erection, you are within 10 years of a heart attack. You are within 10 years of a stroke. You are within 10 years of a myocardial infarction. It's not Dr. Abassi, that is the literature. So the strength of a man's cardiovascular health, check his erection. If he has a good erection, he's cardiovascularly okay.
Wow.
That's not Dr. Abassi, that is research.
Fact.
You cannot doubt it.
Now, before I come to let's discuss about this men's part, this one you're breaking down.
Yes.
Before we come to dissect it more, tell me also the top 3 things that women also talk about or maybe reach out to you for.
Good. One of the best days for me, we are now about 7 years into it, is when a young lady says no to a guy who wants to marry her. And the young lady said, you have to go to Heritage Men's Clinic. The guy was, the ego. What's your problem? The girl said, look, you are satisfied. You are taking care of me. You meet my needs. You challenge me. But the bedroom, now F I give you. So to me, that's a bold lady. That's a progressive future. And that she does not want to face the problem of our previous grandmothers, where, quote unquote, women will tell you they were suffering in silence. Because the truth of the matter is, yes, women love money, but they love knacking past money.
They love money, but they love knacking.
They love
past money.
Past money.
You are sure of that?
I can look, women are hesitant to be exposing their body to multiple men. If you see the woman who is doing hookup, go and ask. They have something is wrong with a real woman, a successful woman. She wants to limit how many men have seen her naked. So if you have been able to get her to the finish line, she's going to cook your best food for you. Your number will be on her speed dial because she knows you have something that most men are lacking.
No, this is a fact. This is a fact. Okay. Apart from that particular one, what else again? Like top 3 questions. You mentioned one.
Yeah. So most women, whether they're selfish or not, they always ask about how can you make the man last to be sustainable? And the truth of the matter is, this is where I get into a little controversy with them. Men, generally, white, black, we feed off of variety. Your woman may be the most beautiful woman, but if they give you the second most beautiful, your body will perform. If they give you the third most beautiful, your body will perform. But if they limit you to only the most beautiful, after a while, there will be less and less performance.
Wow.
What you guys call see finish. See finish will enter. Yes. Then we have a medical term for it. So see finish is not only a Nigerian thing. What makes you and I a man, what makes us chase our women is wired in us, is our testosterone production. But there is a subset of testosterone called pheromones. If my pheromone and my woman's pheromone have been together for years, the attractiveness will go down. I'm no longer chasing my woman the way I used to chase her years ago. It doesn't mean that I don't love her. No, I still do. But let something spice up.
Yes. Yes.
And that makes sense because men do not show love by sex. We show our love, a woman we love, we show by how we support her, how we sponsor her, and how we're there for her. Sex is not one of those things. You and I can bang a girl and we don't remember her name.
True, yeah.
Does that, it's just sex to men is a physiologic need.
Yeah.
So to the women who may be out there saying, oh, why is this man asking for sex all the time? Is it food? Sex is food to men, physiologically.
Wow. That's the second one. Is there another one again?
No, those two things.
Those are two major things.
Honestly, and for people who may be religious, so let me give it out there. We are human beings, we are sexual beings trying to live a spiritual life. God said, go and procreate.
Wow.
That's what God said now. He said, go and procreate. How can you procreate without knocking? That's it now.
Wow.
We are sexual beings and we're trying to live a spiritual life.
This is deep. Now, let me try to go into all this you're saying to dissect them a little bit more. On the men's side, you talked about they are not getting up in the morning.
Yes.
They are not having sex at the right time. And then
they don't last.
They don't last.
2 minutes,
2 minutes, man. Now, let me start with they are not getting up in the morning.
Yes.
What do you think is the reason?
Again, not me. There are reasons, and majority of the reasons you would think Nigeria is caused. We have almost all of them that is causing it. So, a man waking up and having good erection in the morning, it's a cardiovascular sign. It doesn't mean he has to use that erection.
Break down what is cardiovascular.
Good.
That is the
Cardiovascular. So,
terminology.
Cardiac is your heart.
Okay.
That's the only machine in your body. When you and I wake up, it pumps blood. It pumps blood. That's why you can do like this. You lift your hand, your eyes open. It's because there is blood flow.
Yes.
This guy, he needs to wake up.
Also.
When he doesn't wake up, that means there is not sufficient blood flow.
Going there.
Right? And where did they come up with the concept that is a cardiovascular sign when he's not waking up? The reason is the size of the blood vessels. The size of the blood vessel here, they are very, very small. We call them cavernosum. They are very, very tiny. The blood vessels in your heart, they are much bigger. So when you wake up and this guy doesn't wake up, the cardiovascular reasoning is that the blood vessels are blocked. But remember, when one blood vessel blocks in your body, the other ones are going to be blocking. So that's why they said it's within 10 years before this is blocked.
Wow.
So that is why it's not that village is doing you. It's a cardiovascular sign. So when a man wakes up and is able to get good erection, the physiology is saying, hey, your body is intact cardiovascularly. We are made of cells. Cells to tissues, tissues to organs, organs to system. So cardiovascular system combine all the functions of your cells, functions of your tissues, functions of your organs. When everything is in sync, this guy will wake up.
Now, what is blocking the blood flow to that place?
Good. So physiologically, there are things you must do that will make your body produce certain things that will send blood down here. One of them is good sleep. Nigerians are not sleeping. We are sleep deprived.
Good sleep.
Good sleep.
Wow.
Sleep has 4 stages. When you and I, not everybody that is closing their eyes is sleeping.
They are sleeping.
When you are sleeping and your phone rings, you are aware. Or NEPA bring light, you are aware. Your madam open the door, you are aware. You are still in stage 1 and 2. You are not sleeping yet. When you get to stage 3 and stage 4, you are not even aware. Madam can take your cell phone, you won't know.
Okay.
NEPA will bring light, you won't know. But those stage 3 and 4, they are the most beneficial for you and I.
Wow.
right? There is something your kidney does. We like lymphatic system. Your kidney cleans us. There is something in the brain. We call it lymphatic. It only occurs in stage 3 and stage 4. That is the one that prevents you from having memory loss. It is during that phase that your body produces testosterone. You know that organ,
Yes.
that endocrine hormone that makes you get hard on. It's produced during that time.
During sleep.
During sleep. So our people are not getting deep sleep, and so they cut their sleep short. You see a man who lives in Egbeda and is working on the island. He gets home late, 10, 11 p.m. He has to get up 4:35 in the morning. He's already sleep deprived. You cannot tell you the last time he had a good add-on. That is one. That's just sleep. The second one, we're under so much stress.
Wow.
My brother, let me say it again. Stress kills us more than anything.
Wow.
Stress will cause high blood pressure for you because your body is producing cortisol. Cortisol is anti-testosterone. You know, my Yoruba people used to have a proverb. They say, "Inu dundun lo mokole," meaning it's happiness that gives erection. When you are stressed, there is no happiness.
What causes stress?
Multiple things. Of course, we're talking about the state of the economy. We're talking financial. A man, you know, we're still in a culture where it's the man that carries the whole load. He wants to pay school fees. You have seen latest school fees going up? He has to pay mortgage if he has mortgage, or he wants to build a house. You know, he has to be professionally matching up. And madam still wants him to satisfy in the bedroom. So multiple things culminate on that stress. And again, physiologically, if you are sleep deprived, there is internal stress going on.
How do you describe a man that is stressed? What do you call stress? How do you describe, like, if I'm sitting here and I didn't do anything for the day and you say I'm stressed, how do you know someone that is stressed?
Good. So there's a physiological way we measure it, because you don't judge a book by a cover.
Yes.
I can look at you can look at me and say, this guy looks good. You don't know what I'm thinking. But when we do their blood work, there is physiologic blood test
That shows somebody is stressed.
Yes.
Because it may not be that maybe you are doing maybe one kind of heavy work and all of that. Because some people think that they are stressed when they have done heavy work.
There's the man labor. You are doing labor. No, that's not the stress we're talking about.
Quietly sitting down and you are stressed.
You can even look like $1,000,000, but the thing where they go on inside your body tells the doctor that you are constantly under stress. We can measure it. We do it in your blood work. We check your cortisol level. We see that you are stressed.
So that the problem now, someone will be asking, I'm looking okay. How do I know I'm stressed? You have to go to the hospital to do it, or there is any other physiological way you can know that you are feeling stressed. So what other signs can the body give?
Good, excellent question. Number one, we tell men, because it's all about awareness. There are certain numbers that we should know, like the back of our hand. You should know your blood pressure number. When you go and check that blood pressure machine, they should give you 3 numbers. The top one, systolic. The bottom one, diastolic. And then they should give you your pulse. Your pulse is how your heart is beating. Some people, when the stress starts, the way they will know is that their heart will be beating fast. You don't even need a doctor to tell you. So you have to ask yourself, hey, what is making this heart jump like that? Because your body is producing certain chemicals that the heart sense that, hey, this chemical is not meant to be here for long. Why are you producing it like this? That is physiologic stress. So you go to the doctor, and if you know those numbers, they are good for you. There are other numbers. You should know the size of your neck. Because if your neck past 17, you're going to be snoring.
What if it's past 17? Like if it's comfort?
It could be comfort. 17 and above, 85% of those people will be snoring. And some people will think when you snore that you are enjoying sleep. No, snoring is a form of sleep disorder.
Sleep disorder?
Yes, now.
What causes it?
So multiple things. The fat is number one. Number two, some of our people, they come home. That man living in Egbeda, as an example, he gets home at 10, 11. He wants to eat swallow. The moment he will not even finish eating swallow, he starts snoring. When you eat, and within few minutes of you eating, and that food makes you sleep, it's not a good food for you. That's a stress overload.
So now I'm thinking, because you mentioned snoring now. Yes. What I'm thinking on it now, you mentioned Eba.
Yes.
So some people can say they can eat Eba anytime and nothing happens. I can give me any form of heavy food. I don't even get fat. In fact, there are some people that will say this person can finish 10 laps of, and every day you see the person, you say they grow thin, self, you don't even add weight. Some people may not even be eating anything and they are adding weight. So how can you judge that kind of situation?
Good. You know you are in a situation where, based on your platform, and God bless you, you want to give people facts. because you and I can eat 10 wraps of eba and everything, it doesn't mean it's good for us. But our body may not break down right away. It's breaking down small. That man who eats eba in the morning, eba in the afternoon, and says it's okay, has he checked his cholesterol lately? Has he checked his sugar lately? Because these are markers. You know, in medicine, there is something called signs and symptoms.
Even if you are slim and everything is okay.
That is it. Because you are slim doesn't mean you are okay. Now, we have some slim people that had stroke. And then they will say, but the man is not obese now. No, but his cholesterol is more than from here to heaven. And cholesterol blocked the blood vessel, and then he had stroke.
It's not by fatness.
It's not by fatness. So what is it that you are eating? Because that brings us to that food that you ate, and within a few minutes, you start falling asleep. And some people will eat, even they may eat more than you, and they're able to be energized. Food is supposed to give you energy. Food is not supposed to make you get tired.
Let me come back.
Yes.
Now, on the ED that you mentioned, which is erectile dysfunction, not waking up in the morning. Yes. You've mentioned stress.
Yes.
Apart from stress, what other thing again?
The lack of sleep is another one.
Lack of sleep, number two. Apart from lack of sleep, what else again?
All these cardiovascular conditions. Somebody that has high blood pressure. You know, high blood pressure is very funny. Some people will tell you, oh, when I sleep, I wake up 3, 4, 5 times to pee. It's not only prostate problem. High blood pressure can cause that. Because when you lay down and you are sleeping, your heart is still pumping. If it experiences pressure, what does the heart do? It dumps all the blood to the kidney. What does kidney do? Only makes urine. Kidney only is able to do one thing, is to filter the blood and make urine. So when your heart is dumping to the kidney will make urine, and then you get up to pee. So when you are waking up multiple times to pee, if the doctor said your prostate is okay, tell them to check your blood pressure. Your blood pressure may be high. Blood pressure will also cause your manhood not to wake up in the morning. The other common thing for us is sugar. So almost all my patients who are diabetic also they cannot remember the last time they had a morning erection. Because the sugar, one of the things it causes narrowing of the blood vessel. And remember, the blood vessel, we are already tiny. Now, small thing it takes for them to get clogged up. When they clog up, the thing will not get up.
So all these things consist of the things that clog it up. So let's say somebody has this challenge and all of that.
Yes.
What do you need to do to solve it?
One of them, I tell them, not all conditions need a doctor. First of all, ask yourself, face the reality that this thing is not getting up. Not to lie. Don't be in the shadow. Don't be in the closet. No. It's the human body, but you can fix it. Okay, what is causing this thing? Is it my sleep? Try to adjust your sleep. Is it my lifestyle? My brother, we get some people, they look good. They have good money. But they sit 14 hours a day.
That's really a problem.
Sitting is the new smoking. When you sit and blood doesn't flow, how will blood get here? So change those lifestyle. Oh, I heard on this my podcast say somebody should not eat heavy food late. Change that. Don't eat late. Then if you get home at 7 p.m. and the food you want is pounded jam, Dr. Abassi is giving you permission. Go ahead and eat it under one condition. As soon as you finish, go for 30 minutes walk. When you walk, you start mobilizing it. That heavy food will start breaking down. When it starts breaking down, you're going to have a better sleep compared to the days you don't walk around. So first of all, make life changes. If life changes occur and you start increasing a little exercise, if this thing is not waking up, then go and see your doctor. It doesn't have to be Dr. Abassi. Go to any regular licensed doctor, tell them what you are experiencing, and say, hey, I've heard that if a man wakes up and this thing doesn't wake up, that's a cardiovascular incident coming within 10 years. They will do the blood work. It could be your testosterone that is low. It could be that high cholesterol, and then we can correct it.
What if it happens just some few days? Let's some days he wakes up, some days it doesn't wake up. Is that an issue?
No, that's the truth. Because most men will tell you that I get up 3 times a week, 4 times. Good. Those days it doesn't wake up. What I tell you is take a diary. Say, okay, what happened last night? Because the truth of your matter is your body will tell you. Your body just doesn't break up. It will give you sign. So you say, oh, what happened last night? Oh, last night, I had about to go to bed. Oh, I didn't sleep deep enough last night. Oh, something was on my mind. If you take those things off the table, gradually the erection comes back.
Now, let me come back to the first one you mentioned, not lasting in bed. Because after that first episode, one of the biggest calls I received was lasting in bed. And I said, wow, is this how men really want to last long in bed? It's a serious problem, but most people are really quiet and not try to address it.
Yes.
How can someone improve their lasting in bed?
Number one, my grandmother used to say you have to identify the problem. Admit you have a problem. Some men, they say, oh, I've been able to have 4 children. But if you ask their madam, the woman never enjoyed it. Physiologically, when you and I see our spec, we see the woman we want. Our body goes 0 to 60. We act like microwave. But our partners, our wives, they're not like that. Even though she loves you, you still have to punch certain parts. You have to press certain buttons for our body to warm up. So physiologically, we are wired to act too quickly, to ejaculate quickly. So first of all, train your body not to do that. And then turn sex into lovemaking. Bam, 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 2 minutes, you are done. That's not lovemaking, that's sex. You have turned the woman into a trash can. She's not enjoying it. Make the lovemaking mutually benefiting. Let her get her orgasm. You will get yours. And if you start training yourself, it's a condition, it's not a disease. So we have certain vitamins and certain tablets that you can take that will delay your ejaculation. Because most men, the truth of the matter is, if a man is with a lady, whether psychologically he's excited, the man knows how his erection will last. He knows the strength. If he thinks the thing no go last, he wants to go in and do shuku and then done. No. There are conditions like that you can treat. We have multivitamins. We have tablets that will guarantee the erection will last. And so the man can now turn sex into lovemaking. And again, to the question you have not asked, let me tell you, the reason why when you don't last long is not beneficial to you and I is going to make you not to get the woman pregnant.
How does lasting long does lasting long get woman pregnant?
Yes.
When one celebrity says it's 40 seconds that gave her son.
No. Trust me. If they ask them two questions, they will explain to you.
There's one woman, it's not 20, that says her husband was
physiologically,
her child came from 40 seconds.
Physiologically, you and I, when we ejaculate in a woman who is not turned on, who is not wet, our sperm dies. That's not Dr. Abassi, that's research.
Oh, it's not all women that get wet now.
Why? So the woman will not wet, you need to help her get wet.
How?
My brother, it's stimulation.
Some women, they said no matter how you try to get them get wet, they don't get wet. The place is always like desert.
No, they're sick.
They are sick.
Yeah. What makes a woman turn on and get wet easily is her estrogen. So that's why you see women who are menopausal, 50, 60, they get dry and it will take long for you because their estrogen is almost 0. So those are the type of women that you can give lubrication to. But if you get a 20-year-old girl, 25-year-old girl, 30-year-old girl, if she's not getting wet, she has a medical condition.
Wow.
The amount and the ease of getting wet has to do with the estrogen. So younger women are more prone to be getting wet when they meet the woman that turns them on. Again, as a side, remember, your largest sex organ in your body and the woman's body is the brain. So if she connects with you, she's already finding you. The small touch, she will get wet.
So what if, so that means you cannot do someone within 30 seconds and the person get pregnant?
Yes, it's extremely rare, but for pregnancy to occur, you need that vagina to be wet. It allows your own sperm to swim. You know where the sperm is going, it's not like a corridor. It's not A to B. It has to go through some curvatures to find the egg because the egg is hiding either on the left or the right.
And all those juice help it?
All those juice will help it.
Okay.
You know, when you deal with a woman, you knock them. Now here you dump your juice. The egg, 50% will go to the left to look for the egg. 50% will go to the right. Now only one of them will be lucky. And in order to go there, they cannot jump. They can only swim. A fish will not swim in a dry place. Now,
will lubricant help?
Lubricant will help.
Okay, so all these lubricant people buy, if they use it, does it help? Because I hear some people will say the lubricant will even delay the sperm or snatch out the sperm.
No, there are 3 types of lubricants. There is water-based. Water-based is the one that is closest to what the natural body of the woman produces. That is the best. There is oil-based. That one can cause infection. That one can slow down the sperm because oil viscosity. And then there is sugar-based that can cause infection. So if you have option of lubricant, buy the water-based one.
How would you know the one that is water-based?
They write it. Yes,
they write it.
Yeah, they write it on the bottle.
I'm really thinking on this because if someone says, what about people that get raped and they get pregnant immediately?
Good. How many rape has turned into pregnancy? It does happen, but it's very rare.
So you are saying that the woman now bring out juice when they were raping her?
Yes, now.
So she
don't take my
you don't like it, you don't bring out juice.
No, even there have been documents of a woman that was raped, and during the rape, she's telling the man, don't stop. It wasn't conscious of it, but because rape is very traumatic. Nobody is endorsing it. So very rare, very minimal amount of rape will turn into pregnancy. We know it does happen. But what we are saying is, if you follow the bell curve, majority of most people get pregnant when the woman is well lubricated and the sperm can swim. As I explained, physiologically, your sperm and my sperm cannot jump. They can only swim. And they need to swim, not a straight road. They have, some women, how our women are curved now. He has to go left, right, before they can locate the egg and get there. So you need a well lubricated.
Then how long then do you expect a man to last for all those lubrication to happen? Good.
And that is why men are different. But I can tell you, 2 minutes is not cutting it. It doesn't mean that you're a 2-minute man. It doesn't mean you cannot be a father. But for the woman to enjoy it, and that should be the goal of men, that is not just sex. We want to do love making. So you want to be minimally 15 minutes.
Out of 15 minutes?
Yes. Out of your 15 minutes, you want to dedicate 5 minutes to 7 minutes on love making. So even the woman too will get the benefit. It is during love making, your body releases endorphins. These are feel-good hormone. It releases oxytocin. Those are the things that are against pain. Naturally, they release these things that lower your stress level. Why is it that a man, after good love making, he sleeps like a baby? It's because his body is enjoying it well.
Is it the pounding time that should be 15 minutes, or the combined
play,
the combined love making,
yes,
should be 15 minutes,
exactly.
Or just the trusting?
No, not just the trusting. See, when you train yourself very well, you start playing with the woman, leave your boxer on. So you are not just focused on banging. You want the woman to enjoy whatever turns her on. Start doing that. Most women that, she knows that you are not forcing her. She agreed to meet you. 5-10 minutes of that love making, the woman don't wait. You get 5 minutes. 5 minutes of trusting a long time. So in combined like that, the woman will come back again. And it doesn't take long. You too, you go down, drink water, drink some juice. Your body is, hey, I'm ready to go again.
Those that say they go 1 hour, uncle.
We have some extreme people. I will not doubt them, because we have some people that tell you that, hey, even after they ejaculate, they still stand up. If they're not taking medication, it's extremely rare. You know why? And there's a video to show this. Men, the end of our turn on is ejaculation. There is a kill hormone that is released. Our body releases certain hormone like oxytocin. That tells your body to shut down. You have to go through a refractory period. When you ejaculate, it's like you have destroyed some cells in your body. That body needs to realign again. So when you see a man that says, oh, he just keep banging, that's not normal. It doesn't mean that it does not occur, but that's not the normal physiology.
When you ejaculate, is it good to continue or to stop?
To stop. As a matter of fact, at Men's Health, we recommend one good round. We do not recommend multiple rounds. Control your body. This thing is not a marathon. It's not a sprint. You just take time. Please the woman. Let the woman please you. One very good round is better than multiple short rounds. No.
I've seen women that said they don't want more than 2 minutes. What would you say to that kind of person?
Good. If you ask them the deeper follow-up question, why is it that you don't like man? Maybe they don't enjoy sex. Maybe they have a condition called dyspareunia, where penetration is painful to them. Maybe they've been traumatized in the past. The one that liked sex, it doesn't mean they're bad people. But again, we are sexual beings living a spiritual life. Some of us will suppress our sexual tendencies just because of church. We want to look holier than thou. We are born again, we are this. No, but the reality is we're wired to be sexual. The spirituality thing, now they acquire.
Now they acquire, just they bring up.
Exactly.
Now I want to come into the last part of it, which is men not having sex at the right time, maybe for pregnancy. All right, right?
Yes.
So when should be the right time? Because the video that I realized that the video that I posted on TikTok on this time, that is one that had the highest views, over 7.4 million views. And I saw that people actually interested in this time factor thing.
Yes.
When should be the right time for doing that?
Yes. Number one, and most men that I notice in our clinic, because we collect data, most men are guilty in that they don't even know when their woman is ovulating. So I ask the men, don't worry about ovulation. Just find out every month when your woman starts a menstrual cycle. So today is the 5th, right? Any day, pick any day. If the woman starts menstruating that day and you, the husband or the boyfriend, you want to get her pregnant, you guys agree. Count 10 days from that day, including that day. So when you get to day 10, 11, 12, 13, these 4 days, they are the most fertile days. Have sex with her. If you do it well, my brother, you don't even have to have sex all the 4 days. Just have it on day 10. If she's well wet, the sperm you put there day 10, that sperm will be in her body for 2-3 days. So that sperm will be there for day 10, 11, 12. If you skip day 11, so that way you can get your energy back, you drink well, you eat well, do it on day 12. That will cover 12, 13, 14. One of those days she will call you that, hey, my period don't miss. And you know, say the thing don't miss, and now you score.
So that means this thing includes even those that have their period for 3 days, 4 days, 5 days, 6 days, 7 days. It remains the same.
Yeah, medically, we consider that, are you a 25-day cycle, 28-day cycle, or 30-day cycle? That's what most women are.
Yes.
There might be some exceptions that tell you that, oh, maybe I saw my period twice this month. There's a condition, they just need to see the doctor to regulate it. But every month that your woman menstruates, whether she menstruates for 3 days, every days, or now only 2 days, day every, the third day now lighter, she is going to ovulate shortly thereafter. But don't be calculating, don't be using those apps that say, oh, this is the ovulation time, blah, blah, blah. Some of them are closed, but all you want to know is, when do you start your menses this month? I will count 10 days. Day 10, 11, 12, 13. One of these 4 days, she's going to be very, very fertile. You will score.
Even if those, because one of the comments that someone dropped is that, what about those that have 20-day cycle, 23-day cycle, 25-day cycle? Yes.
Remember, it's like a bell curve. Those are exceptions. When that happens, what the man wants to do is, see, every woman that is ovulating, different women have different signs. Some women will have breast tenderness. Some women will have vaginal discharge. Some women will have dryness. Some people will have waist pain. Find out from your woman what she has. So you want to give yourself 2 months, 3 months. You must score in one of those 3 months. If you really pay attention to her, what you need is, when does she start her period? Even if she,
that is when you need.
That is what you need.
That day,
go. Include that day. Let that day be your day 1 and count 10 days. Then from 10, 11, 12, 13, those 4 days, she's going to ovulate.
Because it's more or less like what you say now is more or less like someone. What about somebody that have 7 days cycle? So the person finishes the period in day 7. So you're talking about within the day 3, the person should do something. That day 3 that is coming up is the one that can happen something. What about someone that finishes within 3 days? Are you saying the day 7? The person should also wait up to like day 7 before something can happen, or how?
No, so you know she's your woman. You can make love to her anytime.
Yes.
But this particular period, you are focusing on having a child.
That's what I'm saying.
Our body is not different from other women. It takes on average about day 10 to day 14 for the uterus, where this thing will develop, to be prepared to allow insemination to occur. So if your woman now falls outside, all you have to do is plus or minus 1 day. So you understand? So all this app for ovulation, that is the formula that they input in there.
Let me get it more clearer.
Yes.
I have my period and it's for 7 days.
Yes.
Does it mean that after that 7 days, on the 8th day, 9th day, and 10th day, pregnancy can happen?
Good. Let me answer that. So normally for women to have a period for 7 days is not normal. But we know that there are some women like that. On average, it's 3 days to 5 days. So now, just like we have 3 days, we have some women that say, oh, my period only occur 1 day or 2 days, don't finish. Those are extreme. The other one is extreme. So for you to know your woman well, the day she starts, you count 10 days. So if she finishes for 7 days on day 7, you have day 8, day 9, day 10. Go to her day 10.
Day 10.
11, 12, 13. You will score in one of those days.
Okay.
For you to prove Dr. Abassi wrong, even take her to the hospital when you have not had sex with her. And day 10, 11, 12, 13, let them do blood work. We have chemicals we check in the blood work that will tell us a peak and say, hey, this day within 24 hours, so this woman go ovulate. You go not come.
Now, we just give example with people that have 7 days cycle. Let me come down to people that have 2 days or 3 days cycle.
Yes.
Are you still saying the person too should now wait until the day 10, day 10, or after the 3 days, the day 4, day 5, the person can still score, or it has to wait till that?
Day 10, yes, wait till that day 10, 11, 12, 13. Those ones are the most fertile. It doesn't mean that she does not have occasional fertile days somewhere. Because this study also shows that if you turn your woman on, if you do foreplay, you can actually make her ovulate before she expects the ovulation. A woman that has been following up, that the app says, oh, today is 5, say you're going to ovulate on day 10. If her boyfriend or husband play with her well on day 6, day 7, she can ovulate. So that tells you that this thing is not fixed. So when we give data based on what we have studied, we give you on what is the most common. We know there will be exceptions. And so those kind of things. Again, all this work, if the woman doesn't fast, if the woman goes to some organization, religious organization, and she's fasting, she's going to throw off her ovulation.
Before we come into the fasting, let me leave this the men part and come down to the women that you discussed about. You talked about that most women complain about their husband not doing really what?
Not lasting.
Not lasting.
Yes.
Which we have addressed.
Yes. And the man, 2 minutes, he don't finish.
2 minutes, he don't finish. Which we have addressed.
The erection is not, they come up or is not strong enough.
It's not strong enough.
Yes.
I'm sure that's what you have addressed.
Yes.
Then?
Those are all cardiovascular conditions.
Those are all cardiovascular conditions.
And what we are employing men to do is get it out of your mind that you just want to have sex with this woman. Put it in your mind that you want to do love making. Because at the end of the day, it will be mutually benefiting and it will help you be a father if that is your goal.
Some people are on that religious angle that you're talking about. They may have sexual fantasies. Man may have sexual fantasy, or the man may have sexual fantasy. But one of them is more religious and cannot be able to tell the other person that this is what I want or how I want it. How can a partner be able to tell their partner that this is what they fantasize about, or for that love making to actually happen? Because if you didn't try to get someone's fantasy, maybe anything you're trying to do to get the person on, it may not work.
It may not work. And you are, whether you like it or not, you have lost that person.
Yes.
Because you are not letting them live their true life.
Yes.
My advice is let's leave religion out of the bedroom.
Okay.
If you marry a woman or a woman marries you and you guys chose to be together, what you do there is for both of you. She's your woman. You are not raping her. She's not raping you. You are not forcing her. So let's leave religion out. And again, don't forget, we are sexual beings trying to live a spiritual life. Let's first of all live our sexual life to the fullness. If your woman starts having communication issue with you and you start communicating well, if there is trust, there is nothing she will not do. She will experiment with you. Say, this is my fantasy. I want us to do one style like this, one thing like this. And some women have also complained that, hey, they are afraid of men. If I say this, he will think I'm a shawo, that I've gone to do something. So we need to drop all that. Let's face reality. This new age, we're in 2026. Let's leave our ego out of the bedroom. Let's leave the stigma out of the bedroom. If your priority is you marry this woman, please her. And part of pleasing her, fix your 2-minute problem. Pay attention to what turns her on. It's, yes, this thing is very personal. And that's also part of why, some men or some people will not seek solutions because they don't even know how to deal with it. Again, we have to be mindful of our society, the environment, the hypocrisy, the double standard. But, hey, you guys choose each other. And so your goal, utmost goal, is to be able to please each other.
Let me read this message I got from someone since after that first interview. I said, anytime I have this, the person said, please, I don't know how to handle this. Maybe help me to ask the doctor. I married a pastor.
Okay.
And anytime we are making love, I'll be fantasizing with my other ex before I can be able to be turned on. Or sometimes I will have to watch porn before I can be able to get turned on. And if I try to tell him that let us watch porn to make this thing happen, he looks at me like witchcraft. Yeah. How can I be able to solve this thing? Because he's tempting me to cheat.
Wow, this is real. And I'm very thankful for whoever wrote this. This is real. I've seen this in some men. So it's not only a woman angle. Some men will say, look, I've been married to my wife and everybody, she doesn't turn me on the way it used to be. So the only time my body can ginger, I close my eye and I start thinking of my side chick. So it happens on the other side.
Yes.
In this case, because it takes a strong woman to say this.
Yes.
They need a marital therapy session because they have to get the man out of the mindset he should not be wearing the cap of a pastor all the time. He's not in the church. He's at home because he has a responsibility to her and she has a responsibility to him. And one of the things that will make her enjoy and be a better wife is for that sexual satisfaction.
Yes.
And the man, obviously, he may not even be aware that he's not living up to it.
Yes.
So there has to be a kind of therapeutic session, because the reason why I'm being cautious about that is men are full of ego. Our ego are easily bruised. You understand? If you are not my 5 and 6, I don't want you to know about things I cannot do very well. I want to package myself. I want to do shoulder like I'm doing well. There is my woman that will be able to tell you that this man know they get me to the mountaintop. So like in this case, she needs to find a way. And there are ways that they've recommended. Some literature said put some magazines around him that will discuss that. Don't worry, he's a pastor. He has time where he will be alone with that magazine and he will read and he will now be seeing, these are objective facts. So men full of our ego, when we are alone, when we are reading, we see where the magazine is talking to us. So that might be one. If that doesn't work, then she can reach out, because in that church, they will have counselors.
Let me see. This is where the problem is. There are some men,
yes,
or even if women say, because let's not just say maybe men. There are some women too that could even do that. But let me come. Since she's a woman and she talked about the men. There are some men that what they think about is their Bible, what God says, and what is right within the Bible context. Like you said, we are spiritual, we are sexual beings living a
spiritual life.
So what they think about is all this context. To them, anything that goes out of this context, they are doing something wrong. It's like, as a pastor, you say we want to make love, and you tell me that you need us to watch porn to make love. Does that make sense? That sounds like a sin to that individual, because how can you tell me that we need to be watching porn for you to make love? Or how can you tell me that you are thinking of your exes or some other men? It sounds very weird and it sounds, that means I'm not even enough for you. How can you be able to confront that kind of thing? You can't be able to put it to the husband for that kind of thing to be addressed.
No, honestly, now we're talking fact.
Yes.
And we are facing reality. We're leaving BS aside.
Yes.
That man that is inhibiting that woman is doing a disservice to that woman. Yes, now.
But is woman even right for her to say she needs to watch porn before she can be able to?
She's being honest with you. She's being honest with you. She's being honest. She's telling you what she wants, what will get her to completely surrender to you. And so if you are in a good relationship with her, communication is key. You demand too. You know certain things that you want her to do. And you want her to accept you. You don't want her to look at you and say, hey, did I marry this nympho? Or, no. So give her the opportunity to be able to talk. And you see, this thing is not only among couples, even among parents and children. We kill talents that way. Let her be open with you. What goes on in your bedroom is your private issue. It's not for Bible. It's not for... The pastors are not God now. They are human beings. Again, we have to know the anchor is that we are sexual beings trying to live a spiritual life. So if you want that woman to show you all her potential, open to communication. It doesn't mean that you'll be an angel. I'm not an angel. She's not an angel. She knows her limitations. But if that is what she's going through, that means that she has to close her eyes. She has to imagine being with Benzi or somebody before her body gets turned on. If she comes to you, she's reaching out for help. And the same thing goes with men.
So what you should now do is to allow her to think about her ex while you are on her. Does that make sense?
No, it does not make sense. So you are not going to just say, what do you mean you have to be thinking about that guy? Even I don't even want to hear that you are thinking about that.
Somebody else.
That is it. So that's where you guys go to therapy. Because the therapists are better than me. I'm not a therapist. They will be able to look at what are the options. They've seen cases like that. And then they'll be able to say, why not this? Forget about the fact that it's the ex. She's with you now. She's not going to the ex. You did not catch her sneaking to talk. But she's telling you that, before we used to enjoy this thing. I don't have to think about anybody. But all of a sudden now, because now your shoe is there now, it could be a shoe. Maybe after childbirth, she may have what is called body dysmorphic disorder. Then you too will start thinking about the woman that got you to the mountaintop. So this thing can be very fluid.
So that means it happens that someone has to think of someone before they can get to mountaintop.
Absolutely. And it happens more frequently among men. Men, we claim that we are visual. So when you are with your woman, you propose to love her and you do love her, but this sexual thing is now dropping. We talked about that syphilis, we talked about pheromones. But there is another side chick over there. You hearing her voice alone, the body, but you still have to do your duty at home. So most men will confess, and then they'll just say, I just close my eyes. I just pretend to say I deal with the other woman.
Some people will say this is the reason why you should make sure that you look for a virgin to marry. Because if she doesn't have experience of exes, why would she be talking about, I'm thinking of my ex? It sounds weird. I think that's the reason why she had to share it. I'm not trying to judge her. People, everybody with their own issues. So, but when people think of things like that, they kind of say, maybe I should have go and marry a virgin. That could have been the best way to solve this kind of situation.
Be careful what you wish for. If you marry a virgin, she may even not even know how anything works. And then are you patient enough to get her to your level? And then remember, that woman that your ex or the one you dated that is no longer with you, there is a reason you did not choose her. Right? And so now the one you are, so we do not always get what we want. Let's make the best use of what we have to get what we want. Communication is key. She may not have experience, but the only experience she doesn't have is that sexual. Maybe there are other areas that you two may be lacking and she has experience, and we don't want her to dump us for every time she sees us. So we have to work with it. We have to work with it. That expert was not expert out of her mother's womb. She was a virgin at one time.
Yes.
So somebody taught her all that to get her to that point.
Okay, maybe I will come back to this later, but let me read this other one again.
Okay.
This one said, please, the last person I met, my ex, he has a very huge manhood. Now, this my husband has something that I don't understand. Quite tiny and doesn't really satisfy me.
Yeah.
I do not know what to do. Each time it's inside of me, I don't even feel like something is in me. And I'm really, really tempted to cheat. What should I do?
This is also another thing, Will. This is where women ask, does size matter? So to some women, size matter. But overall, it's not the size of the dog. It's the size of the fight in the dog that matters. How does the man use that tiny? Some men, they are tiny, but they know how to use it. What the woman is talking about here is she wants to feel him. She wants to get to the mountaintop.
Yes.
So yes, she is used to the big one, getting her to the mountaintop. Small ones can also get her to the mountaintop. So the man needs to be educated. The girl may help by introducing toys. Because the issue here is the man himself may not know that the problem with him is anatomical. That is because it's short and that the woman is not feeling it. He may not know. To him, he may think he's King Kong.
King Kong.
And he doesn't realize that he's getting F9. But the woman, you see, this is very private. This is something very tempting. And ego has to be at the play. The man's self-esteem has to be at the play. And the woman doesn't want to step out. Right? So she has to be mindful of that. So sex toys are option. But most importantly is communication.
How can you be able to satisfy someone that feels that what you have doesn't really give her what she wants because she wants it big? How on earth can you satisfy that kind of person?
Let me turn that question for you. Let me play the devil's advocate. What if the man is my patient and the man is saying, Doc, my woman's pecus is just too wide?
It's too...
Say you understand.
And it's true, yes. So he may be saying that this woman's thing is too, I don't feel anything inside there.
Not only that, and it did not start out like that. Some women's pecus loses elasticity after childbirth. If a woman is diabetic and she gets pregnant, the baby will be big. The baby's head will be bigger than mine. My head is already big. It may be bigger than mine. And when it comes out, it loses elasticity. Yes. And now the man will feel like he's swimming inside. So these are these are very, very sensitive issues.
Some is not that they are even giving birth, but the place is just like a well.
They have mileage.
Mileage. So mileage causes well.
Oh yes, now the body count. So somebody who has dealt with cucumber, somebody has dealt with carrot, and you have somebody who deals with double decker. So and one day they're going to be married now, and God now send them pencil. It's there is fire on the mountain.
It's a serious matter.
It's a serious matter. But again, don't let's limit sexual interaction only to penetration. And penetration should just not be penis and pecus. There are other ways. The goal is to get the woman to reach orgasm. Some men are experts in what they call tongue usage. Some men are experts in using toy with their women. And some women too, they do that. Some women will tell you that, look, I never get my husband to come when he's penetrating me, but when I do oral, it gets it. And both of them, they are living their life. They are managing their life.
Let me read this one too.
Yes.
This one said, my husband is a chief. My ex usually gives me head very well. But my husband said he's a titled man and he can never do that. I tried to beg him, tried to do everything possible to get him to do that, but he refused. He said there is over his dead body for him to kneel down and do such dirty thing to a woman as a chief. Please, what am I going to do? I'm really confused, and that is the only thing my body needs.
You see now, this is a legit concern, and we have to be fair. But this is also why premarital counseling is important. Who did you marry? Do you guys even know each other? Did you guys talk? We have to leave all the BS. We have to forget about these religious limitations, these chieftaincy cultural limitations. No, you are going to marry a woman. You want to know what are the sexual things that she loves, what are the things that she desires. You must not find out on day one of your marriage, not the night, because you are in one chance. You don't enter one chance. So this is a young lady that what turns her on is getting that clitoral massage, whether oral or anything. And the man, in his defense, because there are some men that believes that it's against religion. Some men even believe medically, because there have been some documentation of you getting HPV. And HPV can reside in a woman's speckles, and she may not know. And it's not that she's promiscuous. She may just have it. And HPV, some variant, can cause oral cancer. We've had the case of Michael Douglas and all that. So the man may have a legitimate reason. But this is where premarital counseling is important. But we live in a society full of hypocrisy.
Yeah.
And we need to ask ourselves, why is divorce on the high? And why is that people not getting married? It's not that they're stupid. They're just trying to avoid the mistakes of the past.
So what do you expect that kind of woman to do now? That to convince that man to be able to do that? Or she should go and cheat?
Well, anytime you recommend cheating, then your head is on the chopping block. People will look at you in this society. So I would still recommend she should continue conversation. Open communication with the man. Because the man's only excuse now is that he's a chief. And that chiefs don't do that.
Yes.
Number one, if the girl continue the conversation, they will find out that there are potholes in that lie. There is nowhere. There are some chiefs that, boom, again, this thing is all privacy. What makes the man say if you do it, you lose your chieftaincy? Besides, what you do in your bedroom is your own business. So if he satisfies the woman, then who knows? Who knows outside? There are some things behind that we are not being opportune to.
This one is from a man.
Okay.
He said, I've given birth to 4 children and I'm done giving birth to children. I don't like my wife's pickles anymore. I prefer her ass, but she has refused to give me her ass. I like Anna. What do I do to get her to give me what I want?
It may be impossible, like the previous one we talked about, where the chief is refusing to do what the woman wants. This woman too may think that, now, some women religious will say, hey, that's not what, is counter religion and everything like that. And they forgot that their first ministry is husband and wife. So, again, this is not hidden. I believe men are open to variety. If this man had got a side chick or married the second wife may be open to that. But again, communication solves all things. And so I will encourage them to continue communicating.
Let me ask, is
Yes.
anal good? Is anal sex good?
No, so it's not recommended.
Because that is also the problem. If the woman feels that it's not just about religion, she feels that it is not good health-wise. So how is it good or what?
It's not. So it's not recommended. But remember that we're living in a society where all of us are not just heterosexual. There are some people who are homosexual. Their only form of sexual interaction is anal. So who are you or who am I to say, hey, I'm pointing the finger that this is not okay? I can give you the medical facts that
Give me
support
the medical
it.
facts.
If you ejaculate in a woman's ass, you promote infection. Your sperms are not meant to be there. That ass, is just it's the rectum. And when you go in, you're going to meet some SHIT, and it's full of bacteria. So you can, and those bacteria, they're not the type that you should get. So that's not, it's not the appropriate.
It's not the type for man to get.
Exactly. But we know that there are some men that even do what they call prostate stimulation. Some men who are homosexual, they do all that. And we know some women or men who are also bisexual. This is the new day and age. Our own is just to listen, not to judge. And you provide facts and say, look, based on what we know now for scientific reason, this is safe. This is not safe.
Sperm is not good in the ass.
It's not good in the ass.
It turns to virus or bacteria.
Yes. No, so it becomes what we call like food for bacteria.
Oh.
And that ass is already full of bacteria.
Oh.
Until that bacteria, they start multiplying. And bacteria, they multiply like you and I. They go 10, 1 million. Where do they go? They infect other parts of the body. And those bacteria, that flora in the rectum is not good for a man's body to get.
Apart from the bacteria, what are the other side effects?
Even the discomfort. Because the anal sphincter, meaning the gate there, is supposed to only allow one thing to come out. It's not supposed to allow one thing to go in. And that's where the problem comes in. And so you see that most people who engage in anal, they tend to use a lot of lubrication just to reduce the discomfort. Again, to each his own.
But some people say that when the place open, it doesn't go back, and it makes someone that if you want to poo, everything just pours out like that. Does it happen?
Yes, it does happen over time, because what is happening, remember that gate is supposed to allow one-way traffic, and now you are forcing it. That gate is elastic. The more you put trusting, it loses elasticity. And one of the functions of that elastic gate is to hold poop. Okay. You may be in a meeting and you feel like pooping. You can hold it to finish your meeting. But when the gate don't loose, you may even just want to cough. Something don't come out. That will cause wahala. Yes.
So, but what are the potential sickness that someone could get by doing anal?
Number one, so we're not even sure of how many infection can come there, because every man has different flora. And so those bacteria, it becomes another issue. And so not to be alarmist, but this is how all these weird bacteria, weird infection occur. So the goal is let's minimize it. The anus doesn't have a self-cleaning machine, unlike the vagina. The pecus cleans itself. It has glands that God has created there to clean out after each interaction. The anus doesn't do that.
You see some people that, or maybe you see some porn and you see some people that are doing anal, you see how comfortable they are. Everything is open and they are just comfortable, no issue whatsoever.
No, that's packaging. That's packaging. It's not meant to be like that. So it's packaging. And some of these people you see on porn, they're under the influence. Yes. So what they want us to see is what we're seeing. We don't see the behind the scene. We don't see who is directing them, who is saying do this, do that. But they're under the influence and they're doing it for a gain. Whether it's financial, whether it's popularity, they want to become celebrity. We're in a new world.
Now, let me leave these questions for now. Let me come back to my own things. Now, you mentioned earlier on, you said men feed off varieties.
Yes.
Are you kind of saying that it is good for men to be polygamous, to just have different women?
I'm not saying that. I'm telling you that physiologically men are wired to be polygamous. Let me explain.
Okay.
A man functions on one major hormone called testosterone. That testosterone, we produce it on a daily basis. This morning, you don't produce your own, I don't produce my own. One of the functions of that testosterone, it has a lot of functions. It has about 19, 20 functions. One of the functions is sexual. One of the functions is to promote blood flow. It gives us erection. Guess what? Almighty God, Baba God, that gave it to you and I, He allows us to make testosterone until we die. So when you are in your 90s, you can get a woman pregnant. Why? Because you are still making testosterone. And because you are still using testosterone to be sexual. Women, on the other hand, what makes them women is estrogen. That estrogen allows them to get wet. That estrogen allows them to get pregnant. When they reach menopause, whether now 50, whether now 40 something, estrogen goes away. That is a physiologic sign that you are ending your childbearing age for women. Why did God give us license to continue to be childbearing potential? Because we can do it. So where am I going? You marry a woman you like, you marry your childhood sweetheart. In 38, 39, 40, she don't reach menopause. So what are you supposed to do with the testosterone you are still producing? When you don't use it, you lose it. So that's why our great-grandparents will pick a younger woman. Not that they don't love our first wife anymore. They still do, but they know that their body needs to continue to function. And we also know now that when men ejaculate regularly, they reduce certain diseases. Prostate cancer is one of them. Heart problem is another one. So why do you want to stop a man just because the woman don't reach a bus stop?
Wow. So I should have multiple women then?
You should. And study also show, even though people don't want to talk about this, men with multiple wives, 2, 3 wives, live longer than men with one wife.
Seriously?
Absolutely.
Fact. So if I want to live longer, I should have more women?
Honestly.
People say more women kill than...
No. Don't talk to weak men. Honestly, when we're talking manly men that knows how to manage their affairs, yes, no woman wants somebody to share. And that is also coming from how they are wired, because they look at you, all the resources, if another woman, but if you manage your affairs very well, the better option you have, the more longevity you get. And the more options you have, that's where it comes from.
Wow. So those that, because religion now has made it difficult that someone will say, he's marrying more wife and all of that. So they should have side chicks then.
So that's our society. Nigerian customary law does not prohibit you from marrying more than one woman. Now, in Igbo law, say one man, one woman.
And the Bible also said it now.
Okay, tell me how many men of God had only one woman. You see how you
all
think now?
One woman now?
No. My favorite book in the Bible now, Book of Solomon. How many women you get?
Okay, you're talking about men in the Bible.
Yes, now. Okay. So most of these men of God, they had more than one woman. It is this new age, this colonial thing that tells us one man, one woman. And if you look at the history of monogamy, it was based on economics.
Okay, it's economics.
It's economics.
Please give me the history of that monogamy.
So our great-grandparents, let's use Africa as an example. They were polygamous for economic reasons. When, most of the economy in Africa were agricultural based. When it's time for harvesting, they need to go and get slaves or pay for laborers. Then they discovered that if I have more children, the more I keep, the more harvest time, and then we can work. But when the colonial masters came, they realized that, it's about inheritance. So if you have only one woman, she has access to all your stuff. If you have multiple women, then she gets half. That's where it came from. And then when people give you the argument about morality, who's moral? The same people that gave us one man, one woman, they had more baby mamas. Another fact that has been proven. All these countries, Western countries, whether America, whether even go to Hispanic countries, there are more childbirth out of wedlock than Africa.
Wow.
America, 4 out of every 10 children are out of wedlock. UK, about 5 out of wedlock. Canada, about 6 out of wedlock. It's Nigeria that we are not like that. We are not even anywhere close to them. Because they sold us the bag of one man, one woman.
Yes.
And it has never worked for us. It has never worked for them, really. That's why they have serial monogamy.
And that's the reason why infidelity persists over and over again, because people are struggling with something that is not their nature. It's like fighting your nature.
No, you are forcing them to comply. And that is why divorce rate will be on the
very high.
And you're going to be experiencing this low infertility thing, because men are waking up now. Even some women are waking up now that, am I going to commit myself to one thing?
Yes.
Yeah.
So now, does it mean that women too are allowed to have more than one husband too? Are you going to permit that as well?
Okay, good. So this is a good question, and this is where the double standard comes in.
Yes.
But I will tell you the facts, and then you decide. When you make love to a woman or you have sex with a woman, naturally, you are not emotionally attached to her. Remember, we started the show and I explained to you that sex to a man is a physiologic need. It's a food. He just has to exert that and get going on his own. Women are not like that. When a woman makes love to you, a piece of her stays with you. A piece of you stays with her. She's emotionally attached. And so if she now has a second husband, she cannot handle that emotional attachment. So that's why women, naturally, they tend to stick with one. It doesn't mean all of them. We have some women that prefer variety as well. Those are extreme. But men, love making to a man has no emotional connection. It's a physiologic thing.
I've heard that there are some culture that women marry, like Indians. They say they marry their husband, they can marry a lot of them.
Yes, but okay, I've never been to India. I don't know so much about that culture, but I can tell you what science has shown us in terms of even how we make decisions hormonally. To be a man, you have to be full of testosterone. A woman is estrogen. But we have some in between that their testosterone are not up to their parts and they have more estrogen than others. So they may display a combination of these things. But the issue of should women have more than one husband, the question is how can they deal with the emotional connection? When men marry women, it's not because of the sex. That's one thing. We need to really iron that out. Women always make an argument. They think, oh, you are polygamous because you love peckles. No. Men appreciate respect. A man shows love not by sex, by who he supports, by who he gives money to, who he stands by. That's how men show our love. We don't show our love by bedroom action. We don't. It's women that are emotionally attached to bedroom action.
Wow. So what about those that could not marry multiple women? They should be masturbating or how?
Good, excellent point. So the study that says that men that ejaculate more reduces their chance of prostate cancer gave men how to make up that number. The number is 21 ejaculations a month. One of the options they gave men is pornography. Again, we live in a society where we have to be mindful of our culture and religion. Most religions will say no to pornography. The second option they gave men is masturbation. Masturbation actually has been shown to have some benefits, especially in men who are getting up in age. So if that is the way the man can do it, go ahead. I've always been an advocate that even if you legalize polygamy, not all men will do it. Some men are afraid of women wahala. Some men will tell you that, I don't even want to do it. So even if you legalize polygamy now, not all men will do it. But to get the benefit of reduced prostate cancer, reduced cardiovascular health, a man needs to clean his drainage. And you have to do 21 times a month.
So that means you should masturbating then?
Yes.
It's not good. It's not bad.
It's not bad. Especially there have been some articles that show that there is benefit when you're over the age of 50. Your best bet is also to do love making. But in the absence of love making, or you are afraid of women wahala, or you cannot do side chick, then soapy.
I do want to read this question before, but let me read this because I'm talking about masturbation. This one says, please, that video you posted regarding masturbation, I've tried severally to be able to reach orgasm with my girl during sex, but find it very difficult. But with masturbation, I can go 3 rounds within 10 minutes.
Yes.
What is the problem and what should I do?
Good. So this is one of the negative things about masturbation. He is addicted to masturbation, but he's trying to live an heterosexual life. He's trying to get himself to that level when he had conditioned his own brain that the only time he can ejaculate is through masturbation. Yes. So these are the ideal candidate for sexual therapy. He needs to go for sexual therapy where they can kind of break the connection between those two.
Some people say it's not even good at all to be masturbating, that it kinds of weaken your gola, things like that. I don't know how true.
No. Medically, there are benefits. But there have been some studies that show that it's the mechanical, the way you do it. And that's why, the quote-unquote word on the street for it is soapy, or you use something lubricant to increase that. But the side effect of it is that the best way for you and I to reach orgasm is through your woman, through your partner. But when you are addicted, your woman cannot get you up to that point. The same thing goes for women who are addicted to sex toys. There are some vibrators now that act like they're crazy. They have like 4 tongues. No man can match
that. No man can match that too.
That is it. And so a woman who is addicted to that, there's no way you can get her to reach orgasm. It's a big problem.
So how often is too much for masturbation?
If you find out that the only way you get relief, you get the benefit of sex is daily masturbation, you're addicted. Occasional is okay. Because now we have to face reality. Most families are not together. The man is hustling somewhere. The woman is somewhere. So they're not always together. And conjugal bastard. When the woman feels the urge, what do you want her to do? We're in a society where, she's cheating, they give her a bad name and all that. So it's not advisable.
Some people say it causes low sperm count. That masturbation causes low sperm count. Is it true?
That's not true. Who said that? They don't know the science of the human body. Your body is a factory. Your testicle is where you make some of the raw materials that makes the sperm. So it's when your woman comes to you, during that time, you produce it. So if you masturbate today, you can get your woman pregnant tomorrow. It's all about you supplying your body with the raw materials you need, which is water, good sleep, oxygen, good food. That is it.
How long should you wait if you want to make love to your woman to get her pregnant? How long should you wait without bringing out your sperm?
So your chances are best when you wait for like 2 days, because 2 days your body would have gotten all the raw materials. But you don't have to wait. You can get her pregnant today, still have sex yesterday. But it's just that your body produces more. Just like when you're meeting a woman for the first time, you produce more ejaculation during first round. If you want to do second round, there will be less. If you do third round, now less.
Less.
No, you can still do. You can still do. It's just that your chances are better with the first one. You know why? When you are going thrusting in the pecus, if you dump 100 million sperm, the study shows say now only 30 million will even find their way to where the egg is. So the more you produce, the higher your chances.
Okay, and the lesser the chances.
Yes.
Some people usually say that sex is spiritual exchange and it's demonic and all of that. Maybe on the religious angle, that if you are exchanging different partners, you are exchanging different spirits and demons.
That's not scientific. We are sexual beings trying to live a spiritual life.
Break that down.
The way your body is meant to work. We are here to procreate. Every time you've been growing, you are growing yourselves. They get to maturation. There is a reason a 6-year-old girl cannot get pregnant, because the body is not ready for it. But when she starts her menstrual cycle, it's a sign that the body is now ready. That is it. All along, that is the whole world. That's what we are meant for. As we age, our body is maturing and our factory is getting ready that, okay, you can produce this. So where they get this crap about demonic and everything, it doesn't make any sense to me at all. It's not scientific.
It's not scientific.
It's not.
But maybe spiritually true.
It may be. I'm not a spiritual person, so I wouldn't know. But when we go by science, when we go by scientific fact and data, things that you and I can disprove and you can see, it doesn't hold water.
It's good you mentioned that when women start having their menstrual cycle.
Yes.
Some say they have it around 11 years. Some say 12. Some say 13.
Yes.
Some 14. Yes. Some 15. I even heard one lady say 16.
Yes.
Why is that? Why is that difference?
Okay, please. This may be the most important question. You know, we've been talking about sexual cancers in the past. I'm talking in American science world. Breast cancer, cervical cancer, ovarian cancer. All of them have been linked to exposure to estrogen. Almost all of them. If you see breast cancer, when we do biopsy, we're looking for something called ER, estrogen positive and all that.
Exposure to estrogen.
To estrogen.
Some people don't know what estrogen is.
Good. What makes a woman body, when you see a young girl, 9, 10, 11, 12, developing breast and all that, that correlates with that estrogen level production. That estrogen is a female hormone.
Okay, it's an hormone for women.
We men also have it, but our own is low.
And our own is testosterone.
Our own is testosterone. So to your point about what they call early menarche, that is when a young girl starts her period. The study that came out shows that a woman that starts her period late in life, 15, 16, has a less chance of developing what they call reproductive cancer. Less chance of breast cancer, less chance of cervical cancer.
Are you serious?
I'm serious, I'm telling you. That's why I said this may be the most important question you're asking me.
Wow.
Why? When you look at breast cancer, ovarian cancer, cervical cancer, is all connected with estrogen production.
Wow.
So a young girl that starts her period at the age of 16 and she reaches menopause, let's say all of them reach menopause at the same time, let's say 50. So 16 to 50 is 34 years. So that's 34 years of estrogen exposure. Compare her to a girl that starts period at 9. 9 to 50 is 41 years of exposure. That 9-year-old girl has a 33% chance of having either breast cancer, ovarian cancer, or cervical cancer, more than the one that started late.
Wow. Are you serious? So that means starting late is better.
It's actually advantageous.
Because some people will say, I started it too late and I'm worried. I've seen a girl that will say, I've not seen she was 15, I've not seen my period, complaining. That's still fine.
It's a good sign.
Very great advantage.
It's something she should be praying for.
Wow. To have it late. Because she is removing the unforeseen, what they call reproductive cancer. Cancer of the breast, cancer of the ovary, cancer of the cervical. Yes. Some parents don't know this and they may get worried when they see their kids are not having their period maybe from 12, 13.
They don't know that God is saving them.
When is it too late?
So that's a good point. So Literally, what we've seen so far is that there is no late time.
You can see your period from 20.
Yes, because this thing is your body and my body. And why do we know that? Because we see some people now that are even experiencing early menarche less than 9. Because all the food we're eating, all this synthetic food, all these chemicals we're putting is throwing the human body off the way.
Wow.
But the reality is, if we go back to history, there is a way the universe is realigning itself. You know, in the 1910, 1920s, a 15-year-old girl is considered old. She's too old to get married.
Yes.
Now, a 35-year-old girl is not even thinking about it yet. You see how the world is realigning. That is the universe.
Wow. This is deep. Now, I'm thinking, as you mentioned that it's not too late. So that means if someone is in their period, started in their period from 20, they don't have any cause for alarm.
Yes, no.
If you start seeing it at 25, is there any cause for alarm?
Yeah, so all things being equal, the caveat is make sure you see your doctor, make sure. Because why do we say that? Some girls are having their period, they don't even know they're having their period.
How can you have a period without knowing?
Good, because it's not all the period that flows out.
Closing.
Yes, now, you mentioned a girl who may have her menses only for 2 days.
Yes.
The body, when we see them, we may be doing blood work that says that she's having a menstruation now, but she doesn't see anything come out.
Oh.
So that blood, it stays over there, it may clot. That's how some of them develop fibroids.
Wow.
So it's not all the flow.
So if it doesn't flow, it's dangerous.
Yes, now. So you have to ask yourself, what is the genesis of menses? Menses, when your body is ready, when the woman ovulates, that egg that came down, that egg is only staying around for 24 hours, looking for her husband's sperm. If the husband's sperm doesn't come, if maybe the husband traveled and they did not have sex, what happens to the egg? It becomes water and blood for the next cycle.
Wow.
So this thing is a continuous thing. And the uterus is thick. But when it's time for fertilization and this insemination to occur, the wall of the uterus must shed. It is the shedding that causes the blood to come out. So some women will say they have their period for 5 days. Some friends may have 2 for 2 days.
Yes.
No, but the body is still going through that menstruation. It's just that not everything is
not coming out.
Yeah.
Wow. So when is it too early? If someone have its menstruation at 7,
that would be a concern, yes. That would be a dangerous thing. And so, we say a precocious puberty. We're worried about that. Because why is that? What makes that young girl make formal decision has not even developed. It has not developed until 2021. And so when she's already having all these sexual characteristics, she may not even know how to deal with it. And she may be having hormonal imbalance. It's a major problem. It affects mental health and all that.
You mentioned something where we were talking that like you said, in like 1920s,
yes,
a girl of 15 is
considered getting too old.
I'm thinking it's kind of something that happened out there and that would kind of look like dangerous, or how would I put it? Well, it depends on each individual. If you see a young girl,
yes,
12 years old,
yes,
having a period,
yes,
does it mean she's ready for sex?
No, she may not be ready psychologically for sex, but her body is ready for procreation. If that body gets sperm, she will get pregnant and she can have a baby. That's what that signifies. It doesn't mean that she can make a decision. She may not even know her left from the right, which is why there has to be a law to protect those type of people. We still have some cultures in this world where they said it's okay for a 14-year-old girl to get married.
Yes.
She is not matured enough to make decision, to know what she's going through, and to be able to say yes or no. That's why there are laws to protect that.
You know why I'm thinking of that?
Yes.
If nature creates, like you said, we are sexual
beings living a spiritual
life. If nature creates a woman and made her start seeing her period, that 13,
yes,
12,
yes,
isn't nature saying that makes love to this woman and start having children immediately?
Absolutely. And that is how it started in early generations.
In early generation, that's how it started.
But, because they said, this is an American quote, they said, if men were angels, we would not need laws. Let me say that again. If men were angels, there would not be need for laws. It's some men that took advantage of that early age. Yes, that girl is 12, 13. Her body shows that she's ready to get pregnant, but is her brain ready?
Do you need her brain to procreate?
Yes, because she needs to be able to make decisions. She gets pregnant, she has to be able to take care of that baby. What if she gets pregnant for you or for me and we die the next day? How can she handle it? How can she make the right or wrong decisions? That is why we need society to come in. And society has deemed it that we need laws to say, yes, your body is ready, but you may not be ready up here.
Why didn't nature think of that and make that possible?
I don't know. If you see Baba nature, let's ask now. No, you're right. But you see, the nature has given us opportunity to make things better. It's not perfect. We're continuing to work on it to make it better. So if you and I look at a 12, 13-year-old girl,
Yes.
can we give her the license to drive?
If she knows how to drive, give her a license.
Yeah, but she cannot make those decisions. There are some decisions that you and I, we can only acquire them with age, with wisdom. And it comes to us at a certain age.
Time of old, 1920s and co them, like you said.
Yes.
12, 13, 14 years old girls that sent them for marriage already.
Exactly.
They're already out for marriage. Now, go and meet a 14 years of age, they start calling you pedophile.
No, they call you
all kind of weird, blah, 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 blah.
Yes.
But in time of old, it's normal. And most of our parents, that is why many of them were able to give birth to 10 children, 15 children.
Yes.
You see one person give birth 12, 13.
Yes.
But now you've been wondering in this era, you see many of these women, they barely give birth to 3 and they are done. 2, they are done. 4, they are done.
Yes.
So what do you think the society has deteriorated?
So I would say the society has evolved. And in some ways, evolution has been better. In some ways, it has been retrogressive, meaning we have gone backwards. So those days, they will tell you that, oh, women had no rights. It's not that. It's not that women had no rights. They thought those days that men were suppressing women. That's not the case. There were some educated women around that time who still choose to be part of a polygamy setting because they thought it made them better mothers. And there are some women at that time too that did not even have children. They just decided they were not going to have children. So the world has evolved. And with every evolutionary stage, there are benefits, there are lessons, and so we have to pick it together. It's not a perfect situation. So we have to pick it and say, okay, some ways we may have moved too fast, and some ways we have dropped some qualities that we need to take with each other. So you understand. I always say this to my young doctors who want to jackpot. Hey, take the best of Nigeria. When you get there, don't throw everything Nigeria away. Take the best of that place so you can be a better person. But you still see some people, they just want to embrace what is foreign. They think everything shining is better. No. So that would be my own explanation. That yes, we have evolved. There are some things that they were doing great then that work so well that we all can benefit from. And there are some things that we may say, example is this. In the early 70s, there was this drive for women equality. Equality indirectly led to the breakup of homes. Women started working, the children suffer. Because now the man is working, the woman is working, nobody to take care of the children. So if we look back, we have actually failed in that area.
Wow.
And up till today, the study is undisputed. Children who are raised under 2-parent home do better than children raised under single parent. We cannot dispute that.
Yeah.
We can package it whichever way we want. Because you and I can point to one woman or one man that raised the children. Outliers. But that is not the majority.
That's not the key thing.
Yes.
Wow. So that means, is it good to get married to a 16-year-old now?
Okay. Let me answer your question based on science. You want to have the most healthy child. The younger the woman, the better the chance for you. Let me explain. A woman, a young girl that was born today, she came to this world with all the eggs of potential children she's going to have. God has given it to her. You and I, we are producing it as we go. So all the eggs, God has given it to her. When she started her menses, do you know what she's doing? She is losing the egg one at a month, 1 or 2 per month.
Okay.
And when she starts the menses, she's losing the most quality egg.
Wow.
So when she reaches age 30, this is science.
Fact.
She's down to 33% of old eggs.
Wow.
All the good eggs are gone.
Wow.
And that is where that is where our grandparents, they were more wiser than we are. They picked them young. So the first menses, second menses, she's in her husband's house. because they want to use those good, strong eggs. That is science.
Why are we having problem with following science?
Where
Because this is science, why are people not having problem with it? Let them go out there and bring out their quality eggs.
We're moving away from our parents, from the advice, from the family value. A 15, 16-year-old girl now, or let's even say a 22-year-old girl that graduated from Unilag or graduated from University of Ibadan, she's looking at you that she wants to go and make money. And for you to know that they believe in the wisdom of the old, you know what they're doing? They're saving their eggs. They're harvesting their eggs.
To save it.
Wow. They're not dumb, bro. You see what they're doing? They're not dumb. They just want to cheat nature and
cheat nature.
They want to cheat nature.
That is for those that have the money though, and they are wise enough to do it.
God
there are
bless
many
you.
women languishing away without that knowledge. Because society just made them believe that, oh, you have to go through this, like this is the law. Whose, like we say, whose morality are we following? What is right and what is wrong? How can you decide to say this is right, this is wrong?
That is it.
If nature says eat this, why would you say, okay, it's not yet the time to eat it?
That is the hypocrisy. That's what we're facing. And so to each his own, you have to learn about these things and say, you make decisions yourself and say, hey, what's going on? So we see them now, 22, 23, they know and they say, oh, let me just go and harvest my egg. Let me keep it. And then I can come and use it later because they know there is benefit in using. Because the younger a girl, a 17, 18-year-old girl, not Dr. Abassi, this is scientific fact. The egg that she's ovulating is healthier, stronger, better than the egg when she's 34, 35.
When you say healthier, stronger, what does it mean in childbirth? What is going to be the difference?
Less chance of chromosomal abnormality, less chance of her having a Down syndrome child, less chance of her having an autistic child, less chance of her having a cystic fibrosis child.
Whoa.
That is science. Before anybody will, look, there will be outliers. Majority of young women who are in their late teens, early 20s, they give birth to healthier children because their eggs are more quality compared to if they delay childbirth to 39, 40. I'm not saying 40-year-old cannot. You can.
There are exceptions.
Yes, there are exceptions. You can see a 40-year-old woman giving birth to a genius. We're not doubting that.
Exceptions.
But those are exceptions. Majority, the earlier, the better.
Exception doesn't make the rule.
No, absolutely.
The earlier,
the better.
The better. So that's why maybe some people, you see that they have child that you say this is autistic children, Down syndrome, usually come.
Honestly, we see that, like and so to some extent they're even telling men that the earlier you do it too for men is better. That if you stay old, that your sperm may not be as agile as young. Yeah, there are some studies to that. What we actually look at is the average. How old is the man? How old is the girl when they meet together? We look at their average. If you make the average lower, the child is more likely to be healthier.
If a man is 30 or and above and wants to get married, what age range do you think is the best?
So, that question is complex because we live in a society now where men are defining things based on their capacity to meet up what society has labeled them. And that definition is affecting us. Let me explain. Women look at men as only providers. And that is why a young girl who has masters and is making money, she doesn't see the need for marriage because she's looking at you like, how much money are you going to make? I'm making my own money.
Yes.
So we're losing on the bigger picture. The bigger picture is having a good family. We're losing. And it's because they pigeonhole men to be only providers. When she has a man or when she has a child out of wedlock and that child is a boy, as soon as that boy is 12, 13, she's looking for a man that can help train that guy. She forgot about that. So men, to each his own, some men are delaying getting married because they think, oh, I don't have a house yet. I don't have a solid job yet. I don't have a good house. Because they buy into the mentality that you must be a provider. Remember, they did not say you must love. So that's why men kind of got into their mind, we don't show love by sex. We show love by how can I provide for you and everything. If you want to know, for the girls listening to us, if you want to know if a man is cheating, track who is giving money to. No, track. If your husband is giving money to some girl at office, helping her do them, they are knacking.
Some may not be.
There are always exceptions to the rule, but I tell you, 99% of the time. My brothers don't spend money if there's nothing.
Nothing involved.
Yes, now. There might be exceptions. We have some philanthropists.
Yes.
The major men working in the office, you go and track. Let's just do forensic and see. If you see Mr. Benzik sending money to one babe like that, you may not even see the guy's number on his phone. They have it coded. Trust me.
Something is going on.
Something is going. That's how we men are wired. That's how we're wired.
Why does every woman feel different during sex? Why? You see, different. You meet this particular woman, and she feels different. You meet a particular person feels different. Even man too, some women too, they feel different with different men. Even though it's the same thing, the same sexual organ, everything. Why is that different? That different feeling?
The answer to that actually is also very complex, and I don't claim to have the answer to all these things, but women are complex. That at times we even say it scientifically. Women don't even know what they want. And that is why it's not unexpected for you to see a CEO of a successful company and the woman is knocking a gardener. She may be at the stage where all she attracts her is the six-pack. The gardener may not have certificate. When she evolves and she passes that stage, she may now be looking for Mr. Benzi because she knows you are very cerebral. That is the one that when she hangs with her friends, she can say, that's my man. And all they're going to be talking about is how smart you are.
Yeah.
They don't want to know whether you and I have pimples in our face or anything.
Yes.
Then she may evolve past that and say, you know, see that Benzi cameraman? Now Rozo is the man they drive. You know, see the Gucci way he wear. They go through stages like that. So that's why their wants and needs are not, they are very dynamic. They go over time, right? But the truth of the matter is they always upgrade. You will not see a woman that leave you and I for somebody who is broker than us. No, she's going to elevate. She's not going to leave you and I for your cameraman. She go for the MD. That is how they are. Unlike you and I, we may be successful, we may have millions. We don't mind. We can pick a high school person.
Yes.
We can pick the counselor on the road because we don't use that as a measure of who we are. So women are actually very, very complex.
The vaginal construct is different construction that makes it feel different during sex.
No. It's all about what the woman wants to achieve out of it and how you turn her on. Remember, we talked earlier about a woman that likes bigger size. Some women, some of our friends may like the guy that turns them on by foreplay. Some of our friends may like the one that does oral more than anything. So to each his own is whatever she enjoys. And this takes us to another gray area that most people don't talk about. It may be based on their experience. Some women will never enjoy sex because they've had vaginal mutilation. You know, where they used to cut their clitoris. There are some cultures where they do that. So that type of woman, she's never going to reach orgasm because she's been traumatized. Right? And some girls, they may grow up in a liberal home where their parents actually encourage them to experiment. And God save you if you meet that type of woman, because she may have had so much experiences that it may be difficult for you to get her. And you may have some conservative women. She will not even give you a number until you promise that you want to come and marry her. Just because you said you like her, she's not giving you a number until you bring yam. That's conservative. So when you take her home, you have to teach her everything because she may not be sexually experienced.
So now I want to talk about the food we eat.
Good.
Because you made mention of that a lot.
Yes.
I remember the last time also we were talking, at the end of the conversation, we were kind of talking about how we prepare our food that kind of affects our health.
Yes.
What do you have to say about what we eat these days that affect us?
In a nutshell, I want them to know that this is my conclusion. You are what you eat. You are what you eat. I am what I eat. And again, I appreciate Almighty God that this body is the best machine God gave us. Your job and my job is to maintain this body. So let's look at foods that actually nourishes this body. I understand, and I don't want to be insensitive that, look, the economic situation is tough.
Bad.
Some people cannot even pick. They just eat whatever they eat.
What they have.
It's unfortunate, and we hope and pray that their condition changes. But for those listening to us who may have the opportunity to still be able to decide, then let's be careful and invest. One of the people I appreciate and respect so much is Dalai Lama. Dalai Lama said, eat your food as medicine, so you will not eat medicine as food.
As food.
Eat your food as medicine, so you will not eat medicine as food.
As food.
Why are you and I eating food we cannot even pronounce? Processed food.
Like?
So food, any food that you and I put on the table and you leave it for 24 hours and it still look good, it's not good for you and I.
Hey, seriously?
Let me say that again. Any food you and I put on the table, you leave it for 24 hours and it's still good, it's not good for you and I.
Wow.
That is a chemical. That's a processed food.
It has to spoil before 24 hours.
That is it. Because it's reacting with the environment.
Bread has to spoil before 24 hours.
Now, mold will occur. That tells you that this is organic, this is natural.
One woman came online and was complaining of a bread that she kept, and within 4 days, and it's still very alive, like nothing is happening.
Na chemical bread.
Chemical bread.
Na chemical bread. I swear, na chemical bread.
And they actually sued the woman. They said, she's spoiling their brand.
No,
blah, 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 blah. But
I will support that woman. Na chemical
she's
bread.
actually correct.
She's correct. Na chemical bread. Then put some chemical in it that still makes that bread stay
alive
to stay alive. And that chemical is not good for you and I. No matter how they can spin it.
How long is this supposed to last before? But within 24 hours, that bread is supposed to grow more.
Honestly, you're supposed to start seeing reaction with it. You're supposed to start seeing reaction. Remember, that bread has water as part of the mixture. It has sugar as part of the mixture. And that thing is mixing with oxygen. Inside this ear we're breathing, there are some microorganisms that we're not seeing. And that's what they feed on. So they must visit that thing. That is it. So we are what we eat. And if we don't want to eat our food as medicine, or don't want to eat medicine as food, we have to be careful and pick what we eat.
So like what?
Again, what is the purpose of eating? We want nourishment, not just to fill our belly. If na gari you can afford, get the gari without sand. If na peanut you want to put in it, do everything in moderation. Your goal and my goal when we eat is that we want to get more calorie than we burn. But be mindful not to gain too much weight, right? So I tell people that one of the best things about Nigeria is we have variety of nutritious food, but we just don't eat it well. What happens to our vegetables? It's not a must that you and I must eat swallow with the vegetables. Vegetable itself can be a meal. Honestly. And there is nowhere in physiology that says we must eat 3 times a day. There is nowhere. No.
That means you can eat 7 times a day.
If you want 7 times, if you want 1 time, 2 times, it's all about your caloric need. Right? And don't eat because there is food in front of you. Eat only when you are hungry. That is a major thing. Some of us, food there, we just eat, you are overloading your system with too much calorie. And it's okay for you and I to fast once in a while, not for religious reason. It's good for the body. There is what they call autophagy. Automatic phage is how the cell kills themselves, and it only occurs during fast. The cells recognize bad cells. This body and my body, God has created it before there were doctors. And people were not just dying. The body is a self-cleaning machine.
It's like its own hospital.
Its own hospital. It can take care of everything. It doesn't need Dr. Abassi. No. So all we have to do is support that system that God has created.
I think it's mismanagement of the body itself that will provide the need for hospitals.
No, say that again.
Like Dr.
That
Abassi
is it. No, that is it. Jokes apart, I'm a doctor, but that is the reality.
That's the fact.
We mismanage it.
Mismanage of the body is what brought the need for doctors.
Exactly.
If not, there wouldn't be need.
No.
The body does it all.
Go and read about the history of medicine. Diabetes, as common as it is today, is not in the history of medicine.
Wow.
Because diabetes was not even known. Nobody knew. Nobody thought about diabetes. It's a disease of the affluent.
Don't you think all the pharmaceutical people, like people used to say, whether it's conspiracy, I don't know, or the doctors are the ones trying to ensure that they bring in bad food so that people can always come to the hospital and things like that?
No, my brother, there's so much money to be made. Don't believe in those kind of conspiracies. Honestly. And we can give a little bit to know that is not true.
Okay,
Let me give you an example. I was following one of these big astronauts in America named Dr. Tyson. He's a black man, very astrophysicist. And he reminded us about 1500. They were eating organic, no processed food. And guess what was their lifespan? 40 years. If person reached 40 years in the 1500, they say it don't hold. What got us to 50, 60, 70, 80 now is science.
Science, yes, it's true.
It's the advent of research and development. And with that evolution, there will be some benefits, advantages, and disadvantages. Because there is financial incentive, men become beasts when there is money to be made. Again, let us become educated consumers. What you are doing with your platform is educating people. You are not promising that you have all answers, but you say, hey, let me bring the best minds everywhere. Then they will give you the advice. What you go and make in your house is your own. But at least you are not going to say, I didn't know. Now you know. And that is what science does. It doesn't mean that it's all angel. No. There could be some hidden thing. But on the bigger space, on the majority of the function, they have been advantageous.
When it's written in the Bible that some men live 917 years, 755 years, 800 years, are they false?
Who documented that?
In the Bible.
You know,
because what you said, that, you know why I also said it too?
Yes.
It's a fact. I saw it online too, when a man was talking about that in the 1600s, that the highest life expectancy was 30 years.
Yes.
That 200 years later,
Yes.
they added like 5 years.
Yes, yeah.
And then now coming down, now people have added more years to themselves.
Yes.
So it got me thinking. I said, if those times people, the highest life expectancy is 30 years,
Yes.
20 years and co.
Yes.
Where did we read in the Bible that they say someone lived 975 years, someone lived 500 years, someone lived 200, 300? Where did that come from?
Exactly. You know that the actual dating in all these religious books cannot be proved. They will say something like BC, before Christ. So then you have to go and know and say, when exactly was Jesus born?
Was before Christ.
The December Christmas we're celebrating, can anybody prove it to us? So these are things that we have adopted because it was given to us.
Yes.
Right? But have you ever thought about societies like China, India, where they don't have Christianity or Muslim as the majority? Are you and I going to tell me that God did not recognize them? No. The Bible, the Quran, came from the Middle East. So they did not include these Asian countries. So if you look at the perspective of the Asian and you ask them for their history, maybe you and I will be talking about a different date.
That means there's nothing like people lived 900 years in the past.
To be honest,
cannot be substantiated.
That is, it cannot be substantiated. You just say to yourself, how is that scientifically possible? And then what happened that in the 1500s, the average was now 40.
The average was now 40, 30 and cool.
That is, we're retrograding.
Not even 100, not even 200.
That is it. And 900, my brother, you know how you go look? You know how I go look 900?
But people will just spiritualize it. Everything has been spiritualized.
That is it. And that's why when we're discussing things like this for enlightenment, we want to separate the two. You know, let's separate the two. Religion is the opium of the masses. Is one of those philosophers that say. Because when people mix those two together, they will not even listen. And you'll be surprised. They may be PhD holders, they may be doctors who say, why are you not using? There's a reason God gave us intellect. So let's use it.
I remember the other day you talked about when people cook food, salt, the kind of Maggi they use. I want you to go back to that again and explain more. I want to hear it.
If you look at our great-grandparents, they were using salt as a preservative. When they go to hunt, you know, there was no refrigeration. There was no microwave. When they kill bushmeat, they don't want the bushmeat to spoil with different ants or bacteria. They put salt on it.
So they pour salt on it just to preserve it.
To preserve it. Now years later, we can't put salt. They say salt makes this food taste long, taste better.
Hey.
Now let's see the damage. So in physiology and in science, there is a principle that says wherever salt goes, water goes. If you put salt on this table and you leave it there, when you come back tomorrow, now water you go meet. That's how salt breaks down. That's what it does. So when I give you food, I give you layer meat, I give you suya meat with salt loaded in it. As soon as you consume it, they will be pulling water, that salt from your system. And where do they dump everything? They dump it inside your blood. Your blood and my blood, when Mama God created us, is 5 liters to be circulating. When you are eating all this salt, your blood pressure goes up. That is the genesis for black people. Black people with high blood pressure, they tend to be sensitive to salt. So when we give people blood pressure medication, one of the medication we give them is a diuretic, something that makes them pee. When they pee the water out, salt comes out. So salt, if another thing taken, you want to be worried about your performance in the other room, you want to be worried about living long life, you want to be worried about living without high blood pressure, cut out salt. Cut out sodium, which is what is in Maggi.
So you should not use salt to cook food. Is that what you're saying?
If you come and visit me, there is no salt in my house and you will enjoy the food. You use ginger, you use garlic, you use crayfish, you use locust beans, you use cloves. My brother, after 1 week, your tongue will lose salt.
Are you serious like this?
I'm on my life, I'm telling you.
Wow.
Salt causes too much damage. Let me give it to you for you to know fact. Go and Google this. Anytime America kills somebody on death row, what do you think they give them? That injection, that little injection.
Yes, I see the one injection that they usually give before they kill the person on death row.
Yeah, what is it?
It's knock them off now. What does
It's
it do?
salt.
Oh, that is salt?
Go and Google it. Again, that's not Dr. Abassi, that's public information. When they put somebody, say I'm on death row now, and they want to give me little injection, is potassium concentrated salt. Boom. As soon as they give me like this, it comes to my heart. It go just make the heart papu.
So when they kill someone by injection, it's salt that they
That's
give.
salt then they give. I'm telling you information that you can Google.
Salt direct.
Now concentrated salt.
Like loaded of salt. Pack it to your heart straight.
My brother is still driving back.
And they knock you off.
That is it now. Immediately, one doctor will come in with the syringe. It's concentrated. They tie the person down, and if you watch, the man go do like say you get electric shock like this. Because what salt does, it changes your electric potential in your heart. So the heart will pump like this and not come down. Boom, the man don't go. It's salt. It's salt.
Can I stop using salt?
No, so honestly, we need to, jokes apart, we need to, and I know people will say, oh, I've been eating salt before I marry my... No, so start cutting down. When you start cutting down, things you start seeing, you start feeling better. Your blood pressure will start normalizing, and you'll get good sleep.
Some will say I've been eating salt all my life, and I'm still alive. Maybe I'm 50 or 60 or 70.
Yeah, some people will tell you that. My mom used to tell me that. I was begging my mom to stop salt. And my mom said, I've been using salt before I marry your father. So I can see the historical point. Yes, now.
So you don't listen.
Yeah, honestly. Because salt is also addicting. Just like sugar. We actually did a research study. Which one is worse, salt or sugar? You know, some people will say, oh, this man, all he has to do is drink soda all the time. He drink Coca-Cola, he drink mineral salt. Yeah, salt is worse than sugar.
There are always exceptions to the rule.
Yeah, people will tell you. So just like cigarette, you know, they say cigarette is bad. Some people will call you and say, oh, my uncle done they smoke.
Yeah, done they smoke. So, 90 years old now.
Those are exceptions. The majority of smokers are paying the price.
Don't try to think
Don't try
to
do it. Exactly. Don't try to do it. Salt is bad. So especially for black people, salt is bad.
Apart from salt, what else? Our Maggi and co.
Yes, you see, salt and Maggi are in the same category. The good news with Africa, we have a lot of these natural vegetables, natural things like ginger, garlic is good. They are natural spices. It's good for us. But the food, remember I said we are what we eat. So some people will call you and say, now this food I don't eat all the time, and I see the day agile. Ask what are they doing to get rid of those side effects. They are not sitting like you and I are sitting now. Sitting is the new smoking. When you sit for long, your blood doesn't flow. When blood doesn't flow, it clots. So after food is our level of activity we should watch out for. They have some watches now, they call them smart watch. When you sit for 1 hour, it will vibrate or it will alarm you to say, hey, get up. And when you do that, you actually live longer.
So that means we should not use Maggi to cook. We should not use salt to cook.
Absolutely.
And when you say Maggi, just I don't want to mention brands. There are different brands of Maggi.
There are different brands.
Do you think there is anyone that can say, okay, this one is healthy?
There is no good devil. What is bad is
anything
bad.
Maggi is bad.
Don't let sugar coat it. Go and check all of them. Then contain something called sodium. Sodium, that's scientific word for salt.
So that means if you want to use Maggi, look for the one that doesn't have sodium.
If you can get it, good luck. If you can get it.
Is it possible? Is there people that Maggi is not like that?
Again, go and Google the origin of Maggi. Now, some European man started Maggi, and he started it for our great-grandfathers, thinking that we cannot afford nutritious food, that this will make our food nutritious. He can't load down with all the things where we now know, say, na toxin. Again, not Dr. Abassi. Go and Google it. Go and Google the origin of Maggi. And he made it specifically to export to Africa.
And most of these European people, they don't use it at all.
How many times you see Oyibo man always say, give me Maggi? They don't even know it exists.
Serious?
Yeah, they made it to bring to Africa. Again, don't take Dr. Abassi for go and research. Yes. I think if I'm not mistaken, I think the man is Swedish or somewhere in Europe. He made it specifically for African export because they assumed that our great-grandparents were poor and they cannot afford nutritious food like fish or something. So he made all these things. Back then, he thought he was doing good, but now we now know all the things he put together, they are actually toxic to us. Yes.
Maggi, what else?
Salt, Maggi should be a no-no in whatever you do.
Whatever you're cooking.
Yes, just avoid it. But now learn to use more natural stuff. Ginger is natural. Garlic is natural. Cloves is natural, especially for men.
How can ginger make my soup sweet?
Oh, my brother. I know Madam is trying, so I'm not going to. You are the one with a different taste bud. You tell Madam, she will come up with a recipe that you will thank me. Women are very resourceful. Jokes apart. They can do this thing. It's most of us men that keep saying, oh, I want salt in this thing.
Okay, let me leave food side. What about water?
Good. Water is important.
Which I watched a video that talked about the lady was saying that if you're drinking water in a plastic bottle, that is quite bad. But we buy water in plastic bottles every day. So what is bad about that?
Let me even tell you something that is more concerning for us in Nigeria. You know, we don't have public water anymore. Growing up, we used to drink water in the
tap, yes.
What are we missing? That water we're drinking in the tap, it has nutrients like calcium, like zinc, like fluoride. We don't get them now. All the bottled water where we they drink now, pure water, then put there. They are not fortified. Why is that a problem? It's affecting a man's sperm. Your sperm and my sperm needs zinc, needs things like fructose, needs things like zinc, fluoride, calcium. We don't have that. So all the water we're drinking is just pure water. It's not good for us. The reason about plastic is especially when men buy plastic water and you put it in your car, with our heat, the plastic is disintegrating inside that water. Okay. But if you're in your house, yes,
in
the fridge, there's no problem with it.
What about freezer?
Yes, freezer, there's no problem. You can let it freeze and everything like that. But remember that you want the largest organ in your body is your skin. You want your skin to breathe. How does your skin breathe? Hot water will open your pores up. So when you go and exercise, if you now say you can see your skin like it's steaming because you exercise, you burn out all those things out. Yeah. But water. And before people ask, how much water should a man drink or a woman? Drink until your urine is clear and your urine doesn't form bubbles. Those two things you shouldn't see. If you see your urine has a color, your kidney says, I need more water. If you see that your urine, they form bubbles, what is causing the bubble is proteinuria, protein inside your urine. The kidney doesn't want that. So when you drink more water, those two things will clear away.
So that means you're not supposed to see bubble at all, or the bubble can come and go?
No. When you pee inside your latrine,
yes,
pee to the side. No. Pee to the side, let it flow down. If it flow down and you see bubble, your kidney says, I need more water.
Okay.
If you pee and it flow in and there's no bubble, you are good. Again, no color, no bubbles, you're good.
Okay, so that is the quantity of water you can be taking a day.
Yes, because people will ask, different people will
I saw a doctor that said that the pee is clear, it's too white, that there's a problem, that it needs to be a bit yellow.
Which doctor be that?
I don't want to mention his name, but it's popular online.
No, the urine should be clear, like water you drank, and it should not form bubbles.
Apropos doctor, let me just say it. He did a video that he said that if your urine is pure white, problem. Reddish, problem. It needs to be in between, yellow in between, like that.
No. Scientifically, and these are things that we've proven over time, we do what is called urine analysis. Under your urine analysis, there are things that is a no-no to urine. We don't want your urine to be color. We don't want your urine to be cloudy.
Pure white.
Pure water. The water you drank, boom, it should be. What does your kidney is the organ that needs the water the most. And what does your kidney do with it? It's called osmoregulation. It regulates the osmolality. So when the thing that causes osmolality are the things that you and I cannot even see, certain types of salt, certain types of protein, and if those are concentrated, they will change the color of the urine. That's why.
So that means, what a Abroko doctor said, that making your urine pure white is not wrong.
No.
Wrong.
It's misinforming.
It's
them.
It's misinformation.
Misinformation. Your urine should be clear.
Pure white.
Yeah, pure white. No color. It should
No
not
color.
It should not form lemon.
Yes, he said lemon is one that is healthy.
No.
So that's wrong.
That's wrong. It should be clear and it should not form any bubbles. Again, you can go and check it under nephrology. Talk to any nephrology consultant. Your urine should be clear and it should not form bubbles. What is causing the bubble is what we call proteinuria. Protein is like your kidney's currency. It holds on to it. But when the kidney is desperate for water, it will spill protein. When the protein comes out, protein is actually what we call nephrotoxic. It kills the kidney.
Wow.
So the kidney doesn't want to release it. And for you to protect the kidney from releasing it, give more water to the kidney. Yeah.
When is taking water too much? Because I hear that some people died of drinking water.
No. So there are some rare conditions what we call hyponatremia. Remember we mentioned sodium. Sodium is that. So when some people think when you drink too much water that your salt level inside your body is so low that that's bad for you. And that means you have to drink you must be drinking like you're a fish.
Okay, it's almost impossible for someone to drink water like that.
Yes, exactly.
But your system will reject it.
Your system will reject it. And which of your system are we talking about? Your kidney. As soon as you drink enough water, your kidney knows what you need and it knows what you don't need. It gets rid of it. Right? In the cases where I have seen hyponatremia are people with mental disorder, psychiatric patients, and there are some medications that make them just drink like they don't know.
They have too much water in their body.
No, we know it's because of the medication that they take. Yes.
But as much as possible, drink a lot of water
yes.
and ensure your urine is pure white.
Yeah, pure white, and your urine doesn't form any bubbles.
That yellow talk of doctor is false.
It's misinformation. It's not appropriate. Yes.
Wow. Now, someone mentioned about, someone asked a question on that last video. He mentioned that I should ask you about vasectomy and what's the side effect and can it be reversed?
That's a good question. And I can honestly tell you that sounds like a question of a man or a woman who wants to get her husband to do it.
Okay.
So, as two brothers talking now, when a woman come to us and starts, foreplaying with us, start romancing us, our body starts producing, saying that, Benzik and his brother Rashid wants to have a baby. That's the essence of love making. The way God made us is, do pekus and then get the woman pregnant. So along the line, science has been able to see where the production occurs, that it starts in the testicle and your varicose vein will carry whatever you produce and they will take it towards the prostate and the prostate will bless it. So before the prostate shoots it out, there is a tube. That is the vasectomy tube that goes. So science has now found out that if a man wants to avoid getting a woman pregnant, we can actually tie off that tube or cut it. So vasectomy is a same-day procedure in the US, meaning you can do it in the morning and still go to work at night. It's slightly painful. After we do it, we put ice on it because it's extremely sensitive. The question is it reversible? But before we go to is it reversible, is it 100% proof? Meaning, if I do vasectomy now, does it mean I cannot get a woman pregnant? No. Vasectomy only assures about 96%. So there's still 4%, 3% that some of my sperm can still escape. Then, now they do it in a way that is also reversible. You can go back years later. So somebody like you, if you decide, Dr. Abassi said polygamy is good, and you want to, you start coming into money, hopefully you remember me. And then you now come and say you want to take wife number 2. That you've done vasectomy, we can take you back to the lab and untie what we already tie, right? And say, okay, go. And then you get a good woman, she turns you on, you can still shoot. Because we did not stop your production. We only cut off your delivery route. So your factory is in Abeokuta, and we know you only sell your product at Oshodi. We now block the road. So you now came back to us and said, Dr. Abassi, let us do business together. We will come out the blockage now, so it's reversible.
Now, when it comes to sex position, what sex positions usually gives woman the probability of having orgasm?
There's no study that says that. You just want to know your woman's body and know what turns her on. It could be doggy that she likes. It could be the way you use your finger. It could be the way you use your tongue. Anything that turns her on and you're able to get her. Because the woman has control over how her body is responding to you. So if you are doing the right thing, She will let you know.
How do you know bad cholesterol? What is bad cholesterol and how do you know it?
No, you do the blood work. Usually when you come into the hospital or clinic, we do your blood work before food in the morning. And we collect, there are 3 things we're looking for. The total amount of cholesterol in your body. When we break it down, which of them is good cholesterol, which is the HDL, and which one is the bad cholesterol. There is a calculation.
What causes it? That is the thing.
Oh, is when you eat fried food, when you are sedentary, when you eat all this processed food, they are made of oil. Right?
So you should not use oil to cook. Is that what you're saying?
Yes, minimize your oil from
Which
cooking.
of them, red oil or groundnut oil?
Red oil is even worse. It has, yes, but minimize it.
I have studied that red oil is better than groundnut oil.
No. And especially remember, the best oil is olive oil. And our
Olive
people,
oil is groundnut oil now.
no, they're different now. Groundnut oil is different from olive oil. Olive oil is very expensive, not the small man oil.
But it looks like groundnut oil too.
But it's finer. It actually looks like body lotion. If you look at, that's what the Italians always put on their salad.
That's what they use for in the church, that they say holy oil.
Something like that. But you are not supposed to cook it. If you put it on olive oil, it becomes a bad oil.
So how do you use it?
No, you see the Igbo people now, they just put it on your salad, your raw salad, your lettuce and everything. Then they put olive oil on it. That's how they enjoy it. And that's how your body processes it the best. When you put it on fire and the fire don't the burner, it disintegrates, it breaks down.
If you want to cook your stew, you should not put the oil.
Yes, now, honestly.
So you should just cook raw tomato. Then when you are done cooking it, you just pour the oil inside.
Honestly, that is it. Go and do how best to enjoy olive oil. If you put it on it, it's no longer olive oil.
How can you cook? How can you fry your tomato without oil?
You never taste olive oil before? Olive oil is rich. It's really good. It's natural.
How can you cook this stew without oil in the first place? Is there a way that I can cook this stew? Is it oil that...
No, you do it with moderation. You know, our people, if you and I go to some mama put now, oil go to flow all our hand like this. That's too much. But some people, they have cooked the pepper. The pepper is already devoid of water. Then they put 1 or 2 teaspoons of oil. And at that time, they already lower the heat. Because the heat actually breaks down the oil, not absorb the nutrients in it. That is the key. The cocoa is how to know how to prepare the food without breaking down the oil. Yes, now.
I was thinking how it's possible.
Don't worry. Again, go to my sister at home. Ask her. Women are very resourceful. If she has to make this for you and the doctor says it's good for you, you'll see how she'll come up with good recipe.
So red oil is bad?
Yes, and the red oil. So some of the oil, we base them on what they contain.
But this is palm kernel and direct.
My brother, not be all these things, not be all of them, they bad for us. Not be all of them, they good. Our issue as human beings is how do we consume them in moderation. You want to eat a foriro that they cook in red palm oil, you are eating it at 10 p.m. at night. Do you think it's going to digest? Where will all those oils go? They will clog your arteries. You don't want it.
Wow.
Eat it early in the day, 1 p.m. So you can still waka, you can burn it out. You are good because you are still doing your hustling at that time.
So you're saying groundnut oil better than red oil?
Yes, now. Yes, now.
So for those that cannot afford olive oil, how any groundnut oil you buy in the market?
So my point is, we want to remove the difficulty of finances, that because we know things are tough. So my point is, even if all you have access to is red oil, use it minimally.
Okay.
Everything is moderation. Use it minimally and you're okay. Again, don't consume things with red oil. Don't consume at night and go and sleep. Continue to waka. When you move, when you exercise your body, you burn it. It has less of a damaging effect on your body compared to if you eat it late at night and you just go and sleep. That's when it gets into trouble.
Wow, these are quite very deep. I'm really thinking.
Yes.
So we are eating a lot of things without knowing what we are eating.
Honestly, and we need to be what they call educated consumers. We need to ask ourselves, because majority of our people are eating just to fill up. They're not eating for the nutritional value. So some of us do not even know what to mix together. We just say, oh boy, I don't chop, because that is, so it's sad, but that's like a poverty mind. We don't want that. We need to be educated consumers.
What are some of the most heartbreaking things you have seen in medical health, in your medical history?
This is a message to the entire medical community and to us as a citizen of this country. See, we know the state of our healthcare system is less than what we should talk about. But we are each other's keeper. Medicine, when you go to the hospital and a doctor tell you anything, I'm begging you, seek a second opinion. You see, medicine in Nigeria, medicine in the rest of the world is collaborative. Dr. Benzik, I will call you and say, hey, I get one patient like this, so this and this is what I'm worried about. You will look at it with your own fresh set of eyes. You will guide me. We share knowledge. Nobody knows it all. No tree make a forest. We collaborate. Nigeria, we don't collaborate. Now, one doctor in Nigeria, now he want to deliver your child, now he want to operate you, now he want to treat your blood pressure. It's not meant to be like that. Because you see, the medical research and the information, they're coming at you at a light speed. You need people who specialize, and then you need a way to bring them to the table. So we can all say, my goal is to get Mr. Benzik the best advice. So let me bring the kidney specialist, let me bring the heart specialist, let me bring the lung specialist, and present a case to them. I can present your case without mentioning your name. So I will remove bias. All I want them is to give me the best scientific option out there. And so if I'm begging to people listening to us or people who may have powerful connection, is get our medical community to be more collaborative. We are not collaborating.
Wow.
And that is at a smaller level and even at a higher level.
Is it because of money or just jealousy?
Multiple things. Money is there, ego is there, lack of exposure is there. Let me give you another example. So in Nigeria, in Lagos, we have at least 5 cardiac cath, meaning places you can go and they can help you open your heart blockage. Each cardiac center, it takes about $1 million to $2 million to open one. So we have like 5 in Lagos. But let me tell you the sad news. All of them, all the 5, none of them is operating at 20%. What does that tell you? We are not collaborating. Do we need 5? No. Maybe we can get 2 and now refer all the 20% to those themselves. 2. The money for those other 1 million, let's use it to establish something else. We don't even need government for that. We just need our 2 hands to say, you get your own Uber service. I get my Uber service. My brother get Uber service. Then all of us are operating on 10%. Why not, let's say, maybe we sell our own too. So the 10% where you get, let them come to you. So you will be more productive and let demand dictate expansion.
So that person will not be jobless.
That's what they will say. No, the money where we sell our own Uber, we now realize that, okay, you are doing Uber. Okay, maybe we should go to car hire service. So your Uber now will now be based on class, and you can lower price because you are now getting more customers. And those high-end, we can say, my brother can open car hire service. Say, look, my own car hire service, so you can even come and take the car. I don't need to give you driver because you can drive. You have license. I can put. That's how you expand business. And when you expand business, America today, 80% of businesses in America are small businesses. They're not the Microsoft, they're not the Facebook, they're not the Apple. They are mama chops, small businesses, and they hire 10 people, 20 people, 30 people, but they multiple. So people are employed. We are not collaborating. And that is for medical professionals. These are highly educated people. Why? Why are we not collaborating?
You also mentioned earlier on that before we started this interview that we have way fewer doctors.
Yes. Again, that's not Dr. Abassi. That's according to our Minister of Health. In Nigeria, we're down to 34,000 doctors in a country of conservatively 200 million people. How is that sustainable? Let's think about that for a minute. That's like one Nigerian doctor expected to take care of 87,000 people. Let's think about that. Is it possible?
Why do we have that less numbers?
Multiple things. Because I always say, talent will go where talent is appreciated. So a lot of Nigerian doctors are jackpot. What I advise people to do, if people who have power to do anything, the grass is not always greener on the other side. The grass can be greener here. Let's look at what they're doing to lobby them. Can we start doing some of them here? I give you an example. Every corner, every street in Lagos or anywhere you go, there are churches and mosques. Why are they springing up? Because the government has made them tax exempt. No taxes. And human beings, we like to go where money is. This is a business, no tax. They start opening up. Why not incentivize healthcare providers to say you will not pay tax for the first 5 years if you open a clinic and you hire Nigerians and you are providing service? Government will give you tax break. Why not do that?
The problem should be is the government then.
No, it's our people. Let's demand it. Yes, let's demand it. Honestly, let's demand it. I just gave the example. We have all these churches that are tax break. You give them tax breaks, and then you see that things will work. The other thing, our numbers of doctors are so less. How can we bring them back? Let me tell you another personal example. I have a house in Ikeja. I said, let me apply for mortgage. I will not mention the name of the bank. They say, okay, Dr. Abassi, you qualify. We've looked at your books. But the mortgage in Nigeria is only for people less than 60. If you are approaching 60, you are no longer qualified. So then I said to them, how many doctors do you know retire at 60? Doctors tend to work longer than 60. So that is an example where the federal government can say, let's create a mortgage for doctors and let's give them long term for their mortgage. Doctors will come in because you're already guaranteeing them housing. They come in from US, Canada, UK. They just talk to developers. Hey, I want to buy your house. Government will give me mortgage. But now I cannot convince them because most of my doctor friends are in their late 50s, early 60s. They don't have the money to bring over from there, but you are not giving them incentive. That is an incentive that doesn't cost the government anything because doctors will pay you back. They're not going anywhere. And you will use that to improve your healthcare system that is less than appalling.
How can this be solved? Is it possible?
Yeah, my brother, we need to keep talking. The countries that our people are jackpotting into, you'll be surprised that some of the policy makers there are Nigerians.
Wow.
So there is an environmental problem.
I think it's leadership that's the problem.
Yeah,
because
the leadership
if leadership do what is right, it will descend down to others.
It does. But also, we as Nigerians, let us be accountable for our own part. Right? Leadership will do their own. Let us also be accountable for our own part. Yes, we all point finger, and I'm one of those. And I will tell you, so if you give me opportunity, I keep running my mouth. But what are we doing differently?
Now, when a woman squirts, what does it mean when a woman squirts? Is it part of orgasm or what?
Yes, now it's part of our stimulation. You are turning her on. The clitoris, which is like the equivalent of a man's penis in a woman, gets blood flow. The more blood flow it gets, it becomes engorged, just like when a man gets erect. And so the nerve supply there can make her squirt. So it's different from orgasm. But for some women, some people will even mistake the two. They will think, no, it's different. Some women are squirters before she actually reaches the orgasm. Yeah.
Is it urine or there's a liquid special?
No, there's a liquid special. There are some glands that open up like that.
It's not urine.
It's not urine. No.
Some people, it's urine. Pour rivers of water everywhere. How can you call that in squirt? No, it looks like urine.
It looks like urine. But it's a good sign because that means whoever is with her is pushing the envelope and making her enjoy. And you see that when most women, when they even reach the orgasm, they just become like they're paralyzed. And even before it, if you are looking at some of them, because they all have different expression, but it's a good sign that they are reaching a peak.
So someone mess up my bed, does that mean? Does that mean?
That is a good. That's a sign that most men want to have. That's a problem most men want to have. Yes, now.
Okay, let me say somebody.
Yes.
Somebody complained.
Yes.
Got upset and said, "This girl messed up my bed in the name of squirting." Got angry with the girl.
No, who caused it? Now the girl just squirt? No. It takes two to tango now. So
I should be thanking her.
Yes. It's actually, that means that both of them, they are, let me use the religious word, they're yoked. They get each other to the point that you can get the woman to that point. Because you'll be surprised. The girl will tell you that not all men have been able to get her to that point.
What you said is true, because the woman could not leave him again.
That is it. That is it. And I'm an advocate of that. I say, look, if you do love making to a woman and you get her to that point, she will cook the best food for you. Your number will be on her spill there because she knows that most men cannot do that. And she will even take some rubbish from you.
No, this one is true. This one is true.
Absolutely.
Experience makes me know it's true.
Yes. Absolutely.
Now, I want to start that off.
Okay.
I'm thinking, if somebody's thinking now generally, the best way they can be able to have a great sex life and improve their sexual health, what should they be thinking about aside all what you have said?
So they should be open for communication, because even when you are making love to a girl, she knows what you are doing that is correct, and she knows what you are doing that is less than appealing. So be ready to be corrected. Don't let your ego be bruised. And the woman too should be ready for the man to say, look, I like banging you this way. So communication is key. And you want someone that you'll be in tune with. There is no reason why we should be ashamed of this thing. We are sexual beings trying to live a spiritual life. So look, let's forget about all this hypocrisy. It's one of the reasons we were made.
At what age should men start taking fertility seriously?
Depending on what he wants to do. Because what the numbers we're seeing now is that most men are not even thinking of having any children. Most men just want to be free birds because they think it ties them down. And that is a societal thing, it's an environmental thing. Most men are they think the woman is just using them to raise children. And you've had documentations where a woman may have 3 children and none of them belong to the man. You've had that. And a woman will bring another man's child to you just because she knows you are in a better financial position. So men are waking up to that reality that having children is not all that it's cooked up to be. So it all depends. So each is own. Some men still believe in it. The whole institution of marriage is not, if you poll it, it's not at high percentage the way it used to be.
Between lifestyle, stress, diet, and environment, what is the biggest killer of male fertility?
Stress. That's not Dr. Abassi. There was a study that said global fertility has gone down, and they listed 3 factors for global fertility that has gone down. Do you want to know number 1?
Tell me.
Women education.
Wow.
A highly educated woman, she's not ready to be turned into baby factory.
Wow, and it's true. Yes. I think this is an intentional orchestration to make women less of baby factory, or to remove them from their natural environment.
Yes, and we all are paying the price.
Yes,
and if we men are not careful, women are going to remove us from childbirth. They're already doing it. So the fastest growing investment in California as we speak is harvesting of egg. Women are keeping the egg in the bank, and when they are ready to have child, they will just go to the sperm bank and say, this is a picture of a man I like. His name is Benzik. Help me look for the sperm that will look close to this man. I want him to be dark. Are you serious? Yes, now. They go and pick. I want him to be dark-skinned. I don't want him to be too big. And I want him to be cerebral. So they
select what they want.
Yes, select what they want. They'll pay for that, and then they go and fertilize the egg. And they're single mothers. Yeah. And so very soon, you and I are not going to be in the picture.
It's over.
So that's the reality we're facing. That's the reality we're facing. But you see, as the pendulum of women's liberation, feminism, as it has swung away, we were talking about evolution, it has some side effects. There are more educated women now in colleges all over the world. There are more professional women now. And what's the problem? There are less and less men to ask them out. So you have a lot of single educated women who are looking for men.
I've heard someone say that young men these days are more struggling with sexual issues than before.
Yes.
What are the causes?
No, part of that is the societal pressure. When you and I were much younger, a woman is not looking at our financial capacity. She's looking how well we speak, how intelligent we are.
Yeah.
Which course are we studying in school? What is our potential?
Years ago, that is what used to be the norm.
Now she wants you to declare your bank account.
Declare your bank account.
Which one now? Okay, you have been a money point you have. She wants to see. So that is now the measure. So men are even on double pressure. You know.
The environment is a problem.
Honestly.
Because if people, that is why I said leadership is part of the problem. Because leadership has rendered a lot of people poor that people think about, all they think about is their next meal, survival, and everything that's going to give them money. And if they're thinking of that, other important things are being taken away from them.
Absolutely, you are right. We're in survival mode, but we also have to blame. I was listening to a speech by one of the CEOs of Money Point. I think he's the CEO of Money Point, and he made an excellent speech, and he's talking about Money Point has about 500 open spaces for people to hire, and they're not seeing qualified Nigerians.
Wow.
And this is a guy that is 100% patriotic, if not 1,000%. He loves our country, no doubt about it. So he's crying out, he's begging. And he alone, he does not promise that he has all the answer, but he's identifying what it seems. He said part of what he's observed is lack of role model. You know, you and I growing up, we had role models that we want to be like. So you are not going to come and start acting like Yahoo, because your role model is not a Yahoo boy. Your role model is somebody that is well-cultured, educated, has his stuff together. He doesn't have to be a millionaire, but he has his stuff together, and you know he can give you a 5-year plan. Our society now, you and I are trying to mentor somebody, and he's asking you what kind of car you drive. So our culture, the environment we're in now, they're assessing you before they even know what you bring to the table. They're looking at you, what kind of car are you driving? What kind of watch are you wearing and all that? So it's so materialistic.
Yes.
And these things are temporary. Because they may see us today, we're struggling. It doesn't mean we're going to struggle for the rest of our life. But they will lose out on someone that has good family values. Good potential. And that is why. So the generation we're seeing now, everything they prioritize is so fleeting. Money. It's so fleeting. It's not something that concrete, not something that you can hold on to. And they are the generation of microwave. Now. They want everything now. And they don't want to walk and wait for the process.
This is major, based on your experience, this is majorly in Nigeria now. Is it obtained with other places as well?
No. It's different because the key factor is environmental.
Yes.
The other countries, I can tell you for a fact, someone that alternate between US and here, the hookup culture in Nigeria is way lots on a super level. Higher.
Hi.
Right? And the excuse for the women is, if you get a girl in Nigeria that does hookup, if she jackpot to UK or to US or to Canada, she doesn't do the hookup anymore. Why? Because she sees better opportunities. She now has the opportunity to go to school where she can be paying gradually and working, hustling 2 jobs. She can keep her own apartment and she can plan. But here in Nigeria, those opportunities are taken away.
That's what I said is bad leadership, because all those opportunities that are supposed to keep our women at home or make them productive are taken away. Many of them are living hand to mouth. You really cannot really try to curtail what someone can do when the person is hungry, because the system is about survival.
No.
If somebody is struggling to survive.
A politician once said, may your loyalty not be tested.
Yes, that is the word. That is the word.
That is it. And that's what so most Nigerians are in a survival mode.
Survival mode. How do you try to stop that person from Yahoo or from prostitution? Or it's crazy to think about. Each time I think about it, it's kind of crazy. I said, this is what our politicians are rendering our people and our young ones.
Yes. It is tough. And yet, we are approaching political season now, and our people are still going to take 5,000 naira to vote for the wrong person. That is the weaponization.
The weaponization of poverty.
Yeah.
It's crazy, man.
It is.
Now, a man talked about a refractory period. You also spoke about it.
Yes.
Now, I think it's based on age, right? That determines how long that for about refractory period. I'll talk about it. Let me hear more.
So a refractory period is normal. It's a physiological process.
And refractory period is the time it takes man to come up again after sex.
Exactly. So when a man starts getting into the foreplay mode, getting ready to have function with the woman, his body is going. When they start having intercourse, start having sex, the whole process ends when the man ejaculates. Whether he likes it or not, contrary to what some people will lie to you and say, hey, I ejaculate and I see they go. No, it's not physiologic. As soon as you ejaculate, your body releases a certain powerful hormone called oxytocin that shuts you down. Boom. Telling your body to repair itself, to relax. That is what is called the refractory. So the time it takes from that release of that kill hormone called oxytocin for you to be able to get it up again and say you want to go, it's called your refractory period. You made mention, you were leading me saying it has something to do with age. Yes, but not fully, yes. It also has to do with variety. If you and I just don't finish now with one woman, and I say, hey, get into my car, and I drive a Porsche, and then we go to another nightclub, and you see a fine babe.
Get up again. And it's true. Get up again immediately.
That's your variety.
But if you're back to the other person, you will not get up.
Exactly. So the human body is very complex, but this is reality.
But by age, does it go down by age?
Yes, it does. Age. It does with age. And the caveat to that is with age, we tend to stick with the same person. But that 70-year-old man, if you give him variety, that refractory period gets less and less. Before, it may take 4 hours. If you give him variety now 2 hours, you give him some variety that he's been looking for now 1 hour. So it affects it.
What do you need to do to boost the variety time more? Is there possibility? Is there
No, because your variety you don't have control over. But after each time that you've ejaculated, the best bet recommendation for you is relax, eat, drink water, let your body use the nutrients, and then you're ready to go.
Yes. Variety.
Yes.
So we should have
it's the spice of life.
Varieties.
Yes.
Because all the plenty women that we have, if we don't pack all of them, who will pack them?
No, we're in trouble. Jokes apart, honestly. Even for women, for people who consider themselves feminists, we need to start addressing that issue. There are more qualified women out there, very beautiful. They have good financial potential. They're educationally sound, but they don't have men. And part of it is the double standard. The last 50 years, most governments have done women empowerment, girl empowerment. Nobody talk about boy. And now the boy environment, the discrepancy is obvious. There are more girls in colleges, there are more girls professionals, and the boys are not catching up. And so even think about it as a family man. If you have daughters and your daughter has all these qualifications, where is the boy? Some boy in Korope will now be trying to toast your daughter that went to Ivy League, your daughter that is making 6-figure, your daughter that has her stuff together. When they bring the Korope boy to you, but that's the reality.
But I mean, you have a lot of varieties and side chicks then.
No, me, I believe in it, honestly. And that is my goal. It's not about a disrespect. For me, I see the medical need for men to ejaculate frequently, for men to get good sleep, for men to have internal reduction in stress. These are all benefits you get with lovemaking. So whichever way you can do it. If you are the type that you say, oh, you are religious, okay, you want to do masturbation, it has its own side effect. Or pornography, it has its own side effect. Then the option of having variety, don't preach morality to me. I will not preach it to you, but I will tell you what are the scientific and health benefits of it.
You are speaking on facts.
On facts. And I also tell you that, yes, our great-grandparents may not be as educated as we are. They may not be as exposed as we are. But I know one thing for sure, they were wiser. And most of them had options. They were polygamists.
Yeah.
They had concubines.
Yes.
And they were able to manage it.
So that means the goal is 21 times a month.
Yes.
You should have sex 21 times a month.
You should ejaculate
21 times a month.
Yes.
That's not too much.
No. Who said it's too much? If you have a woman that you are with together, she gets you to the mountaintop in the morning, you are nice to her, she does it at night. That's 2 days in 1 day. So in about 10 days, you already reach your goal.
Except if that woman, like you said, variety.
Yeah.
It's someone you are used to. Exactly. You come back in the night and you don't feel it.
You don't feel that's
you come out the next day, you don't feel it.
That's
already.
No,
yes. Body tells you no, you want something different, something new.
Yes. And we see that, and that's where the problem is, because women look at you looking for option as if you're promiscuous. As if it's a disease. No, it's not. That is just the reality. And I made a statement one time. I said, if the shoes were flipped and women are the one that they said, look, if you don't have enough sex, you're going to have breast cancer. Women are going to, you cannot say no when you are homo. She's going to go and outsource it. That's when you know she's going to call people, and before you know it, they take care of themselves.
Is our average diet harming us long term?
Yes, because, and again, we have to do everything in moderation. Most of the food we still have are fresh produce compared to the Western world, but the timing and the quantity we eat. Have you been to a Nigerian restaurant lately? They serve you as if it's a 4-course meal for one person. And again, because of our poverty mentality and our survival mode, we just want to consume it. We're not even eating for nutritious reason anymore. We're just eating for feeling. And we have to be mindful. There is no physiologic need for us to eat 3 times a day. We have to remember that.
Is there a medical cartel controlling healthcare in Africa?
Well, I don't know. I hope so. Let me say that again. And I'm not saying that just turns easy. Africa doesn't have healthcare. That's the problem. So if there's a cartel out there that wants to bring the standard up, please let them come. I will take that compared to what we have now. You know, Nigeria, the most populous black nation on earth, we're down to 34,000 doctors. You know, I listened to a lecture where the commissioner for health for Lagos said to bring Lagos State health, the Lagos State healthcare system, to bring it up to the par of his dream, meaning to meet international standard, that Lagos State needs 33 trillion naira.
Wow.
33, let me say it again.
Wow.
33
trillion.
To bring Lagos State health.
That's like over $25 billion.
Exactly. To bring it to the standard that he hopes with.
Is that why many of our doctors travel abroad for medical treatment?
It's one of the reasons. Not only that, how many politicians do you know stay in Nigeria for their healthcare? They are the people who are supposed to advocate for our healthcare. They don't trust it, so they go abroad.
Let me round off.
If I have a advice to give,
yes,
because we all need to be educated consumers. The problem we face in West Africa are not infection. They are cardiovascular problems, high blood pressure, diabetes, stroke, heart disease, metabolic syndrome. When these things happen to us, by all standard, you need a doctor to stabilize you within 45 minutes to 90 minutes. So to all my rich people in all African countries, you cannot get to UK, you cannot get to Dubai, you cannot get to America in 90 minutes. So why not invest locally for urgent care centers, for stabilization centers, and get doctors? This may help you. You may not need it, but in case you need it, you are guaranteed. Because there is nowhere I'm going to call any doctor in America for you. The first question they're going to ask me, Dr. Abassi, is it stable? If I say yes, they will say, oh, okay, when do you want me? How do you want me? Send a jet, I'm coming. If I say you are not stable, they will say, get him stable.
What are developed countries doing different in their healthcare that we are not doing?
Good. Number one, to start with, is investment. I mentioned Lagos State saying they need 33 trillion. Federal government said they need 300 billion. You see that there's discrepancy. And Lagos State, the most populous, at least that we know, we need to get things up. Again, Nigerian healthcare system, basically the way it works now, you go to emergency room or you go to some doctor's hospitals. In the Western world, like in America, we have doctor's office, we have urgent care, then emergency room. Our goal is to reduce the number of people that end up in our emergency room. Because we know when you end up in emergency room, more are likely to die. So we want prevention is better than cure. Nigeria, majority of people go to the emergency room. And they go to emergency room where doctors are no longer there. So there is fire on the mountain.
What would you change in Nigeria's healthcare system if you had one power?
Oh, fantastic question. If I have one power, I will invest so much in data. Data is the new gold. Nigeria doesn't know how many doctors they produce. Nigeria doesn't know how many diseases are rampant. Nigeria doesn't know how many medications come into the country. Nigeria cannot honestly tell you how many people die a day of heart attack, of stroke, of diabetes complications, of basic infections. Nigeria cannot tell you. So if we invest on data, data is the new goal. Data will now tell you and I, where should we build our stroke hospital? Where should we build our cancer hospital? Where should we put women's health? Where should we put pediatric? Data will tell us. Right now, we're behaving like a chicken without head. We're moving. We want to do this. We're not following data. Data overall, it may be expensive to gather, but it saves us money longer. Nigeria does not even know how many specialists we need in different fields. If we have the data, we can now have a data bank to see how many Nigerian doctors are making mistakes, how many Nigerian doctors need retraining, how many Nigerian doctors need sanctioning, how many Nigerian doctors we need to encourage to come to certain villages. You know, how many ambulances do we need to? If you and I, as we're talking now, if we call 911, I can guarantee you we're not going to see an ambulance in 1 hour. Data will tell us that.
Wow. That's number one thing you would have changed.
Honestly, yeah. Let me give you another thing that I find fascinating. In the state of Maryland, where I live, we have 42 critical care hospitals in the state of Maryland. And it's a state of 7 million people. 42 critical care. If you come and visit me and we're playing in my house, we can pick up the phone and call 911. You know, before the 911 gets to us, they already know that if we need to be hospitalized, they already know which hospital has a bed and which one doesn't have a bed. So if they come and they show up and I say, oh, I'm Dr. Abassi, this is my brother Benzik, he was just complaining of chest pain and I'm worried about him and I need him to be taken to the hospital. Hospital may be next to us, 5 minutes away, but that hospital may not have a bed. But that ambulance is already being spoken to that no. Does he need to go to the hospital? Okay, take him to Yaba, take him to this. And when you get there, they're already expecting you. How are they able to do that? Data. The state has a position they call the nurse czar. That nurse czar could be a man or woman. But all the 42 hospitals, they report to her every morning. We have 10 beds open today. We have 15 beds. We have this. So she knows real time. So when 911 emergency calls come in, they already see our data. So you and I are in Ikeja now. Ikeja hospital may be full. They may say, no. Take Benzik to Alagomeji. There is bed there. So the ambulance is not going to waste time. Boo! And as soon as they get to Alagomeji, they're already expecting you because they know that they've gotten message that we're coming. Data. Data is the new gold.
Very important.
It's very, very important.
We have a problem with keeping data in this country, and that's quite challenging. Almost everything our data collection is quite very bad for us.
You know why? We thrive in chaos. No, we know data will change a lot of things. Data will change a lot of things. Data will give you accountability without you asking.
Exactly.
They know, but they don't want that. So even if you put data in place, they want to mess it up.
They want to mess it up.
Yeah.
Yes.
Because they like the chaos. So we have to fight for it.
I'm running up with these rapid fire questions.
Okay.
If I ask you, just give me
No problem.
short answer or one answer.
Yeah.
One habit killing men's health the most.
Sedentary life.
Sedentary.
Yes.
Wow.
Sitting is the new smoking. We need to move.
One food men must avoid immediately.
Heavy starch. Carbohydrates. Eba. Amola. Pounded yam. Semo. We need to avoid it.
Rice.
As much as possible.
Someone like me that eats rice every day is
Yeah,
bad.
rice is okay. Rice will even digest faster than eba. You know, those ones take hours.
Semo.
Rice. Yes, semo. Amola.
Wheat.
Pounded yam.
Wheat,
Yeah.
okay.
Wheat. Yeah. The
Wheat
wheat.
is
Be
okay.
careful which wheat you take. Or the Chinese wheat is loaded with sugar.
Ah.
Yes. Get coca oat. You know the old coca oat? Let them blend it for you. That's your best wheat.
How would you know the bad wheat? I like eating wheat when I go for a restaurant.
No, every time you eat wheat, tell them to check your sugar after. The one that shoots your sugar up the most, you know that this is not good for you.
Normally, when you eat food, your sugar shoots up. No?
Yes, now, but not all food.
One habit every man must start today.
Oh, walking.
Walking.
Yes.
Alcohol or smoking, which is worse?
Both of them are bad, but some alcohol are good. So red wine is recommended. Smoking is a no-no.
Smoking is a no.
Smoking is a no-no. Whether it's shisha, whether it's vaping, whether it's cigar, smoking is a no-no. And especially to our asthmatics. When you smoke, all your asthma medication don't work.
Gym or walking, which one is more
Walking.
important? You mean, I've been thinking of this. You mean walking is more important than gym?
I will share you a video. American government invested in the largest research, and the conclusion, the human genome, is that men are designed to walk. We are not designed to swim. We're not designed to fly. When you walk, you name any disease, I will close my eyes and I will tell you the percentage of how it will disappear when you walk.
Seriously?
You name
Walking?
it. Hypertension, diabetes, stroke, heart attack, prostate cancer, ovarian cancer, breast cancer. Walking makes everything better.
Do you know how many people I would tell them, let's say there's a short distance, let's trek, they will start calling it poverty. Why would you be trekking? Trekking, why would you be trekking? You don't have money, enter. Some people from here to this, you see distance of like 2 minutes.
That's why we're dying.
Fly this.
That's why we're dying.
And that's why we're dying.
That's why we're dying. I can look them in the eye and tell them that's why we're dying. Sitting is the new smoking. Walk. We are designed to walk. We're not designed to fly. We cannot swim like fishes. We are meant to walk.
Is walking ever too much?
No. And all we need you to work is 30 minutes a day, 15 minutes in the morning, 15 minutes at night. Almost all diseases will reduce in the impact.
I mean, it's more important than gymming. Because people go to the gym centers, carry this, do all the form of things, lifting.
Walking.
Wow. Sleep or diet, which matters more?
Sleep.
Sleep is more important than diet.
Absolutely. And there's scientific proof. Only sleep can improve what we call telomeres. The length, how long your telomere is, determine how long you live in life. Let me say that again. On your DNA, on my DNA, on your cell and my cell, we have what is called telomeres. They are tiny. They look like the tail. The longer your telomeres, the longer you live on life. And only sleep can improve it.
What is telomere?
Telomere is like a part of your DNA that codes. It has some secret. God gave all of us. But all of us have different lengths. The longer your own is, the more you live in life.
How many hours sleep is good?
So it's based on your age. 6 to 8 is for your age and my age. Anyone above 40, 6 to 8 hours. When you're talking about sleep, there are two things. There is quantity, how many hours, and there is quality. So when you get that smartwatch, it will tell you how many hours you spend in stage 4. The more hours you spend in stage 4, the better you'll be. And the extra, the more hours you spend in stage 4, the more strong your erection will be in the morning.
So sleep is better than diet?
Yes.
Stress or food, which destroys fertility faster?
Stress.
Biggest lie men believe about masculinity?
Men don't cry.
So men do cry?
Men do cry. Real men cry. Real men are in tune with their emotions, and you have to be. So it's a fallacy to say men don't cry. Real men do cry. We have emotional part to us. We are big teddy bears. Yeah.
One thing men should never ignore in their body.
Oh, good. I did this yesterday. So there are signs and symptoms. So I always tell people, old age, the part of your body you need the most is your leg and your brain. When you start having swelling in one leg, you're going to have blood clots. When you start having swelling in both legs, your heart is failing. So don't ignore. Watch your legs as you age.
One truth about healthcare people don't want to hear.
Health is a form of wealth. It's not the only wealth, it's a form of wealth. Your network is another wealth. Your connections is another wealth. Your professional circle is another wealth. Your environment is another wealth. But health is a form of wealth.
Should men freeze their sperm for premature protection?
No need.
No need.
No need.
IVF in one word.
It's a scam.
Are you serious? IVF is a scam.
The best IVF center gives you 33% success.
Whoa.
And the best sex gives you 50% chance. So pick.
Can you imagine? I used to think that IVF is 100%.
No. The best chance of IVF, even in the best of hands, is 33%.
Wow.
And sex, naturally, 50%. So pick.
It's really a scam.
Pick.
And they charge crazy for it.
Yeah. And it's because of the environment. And part of it is, women delay childbirth, so women get older and then they say, oh, let me take your egg. Remember, we talked about it. The younger woman, she doesn't need IVF. The younger, the better. When she's old, she has wasted all the good eggs. She's now left in her 30s with less than quality eggs and even less number.
Should men look for virgin or not?
No need. Be careful what you ask for.
I would just say no need. Doctor.
No, this thing doesn't keep number. It doesn't keep number.
So you want the man to be experiencing that woman that says she's thinking of her own egg?
No. So do you want a woman where you are going to teach everything?
Why not? Teach her. That is the beauty of life.
You may not even be in a position to teach her if she thinks she makes more money than you. She does not respect you. So a man doesn't need virginity. A man needs a woman that will respect him.
So you can go and pick a prostitute and marry them.
A man needs a woman that will respect
It's
him.
like telling women to go and prostitute.
No. As a matter of fact, let me tell you something. There is a Ivy League college in America. I will not tell you whether I went there or not. One of our chief of surgeon is married to a stripper. And he said it's the happiest time of his life.
Exception doesn't make the rule. Don't forget
Absolutely.
that.
I agree with you. So that's why we should not even limit it. Remember, we are the one saying this woman is a prostitute, is that. We're the one talking about side chick. And side chicks now know save marriages. Right? It's the double standard.
What of the ones that have got maybe have had different abortions? You now go and marry them, maybe they have lower risk of conception.
No, you can marry a woman that she may have had abortion in the past. She didn't tell you.
That's why you should marry a virgin.
Be careful what you wish for.
Even Christ, that even Bible that said Virgin Mary was the one that he chose. There's a reason. Why didn't he pick any other woman from the streets?
Well, when we meet Baba God, let's ask. I don't know. You may be right. Honestly, you may be right. But I just think that men generally, we are okay. We are in tune with a woman that respects us. It's less of a virgin state. If you have a woman that respects us, that appreciates you, everything you do for her, she values it.
Most do like they say, exception doesn't make the rule, but the exception. But most women are more feminine when they are virgins.
Most women are more feminine?
Yes, as virgins. Because they are more respectful. They are more all these things you are requesting for as virgins than if they are.
No, I can see that compared to if they've been exposed. If they've been exposed. So I'm going to tell you my brother's proverb. In your local Shinloro, meaning horses are not mean. It's people that make them mean. So it's men like you and I that make those virgins become mean. Ogolobo. They were not meant to be like that. But no, I can see your point that if they're still without that experience.
Yes, all this experience.
Yeah,
they're more coachable. They're more open-minded.
I can see that. But this generation, you have to. You're on your own. No?
Nigeria healthcare in one word.
Non-existent.
Wow.
We don't have healthcare.
Men's health in one sentence.
Needed and more to be invested in. Everywhere you go, there is women's health. Men's health is needed and it's a place, it's long overdue. It's long overdue. And there should be nothing to be ashamed about.
Most important thing a woman should look for in a man.
Stability.
What do you mean by stability?
He's got himself together. See, men also go through phases. The days where you are still struggling, you are getting yourself, but when you have gone to that point where you are okay now, sure you understand. That stability, professionally, you are stable. Financially, you are okay. You may not be Dangote, but you are okay. At least if you want to buy one bedroom, you want to rent, you can rent it. You can still provide 1 or 2 meals for yourself. So that means you are stable. You know what I mean? So that stability is key. Before you put on another responsibility, you need to be stable.
Most important thing a woman should take care of in her body.
Most important thing a woman should take care of in her body is her brain.
Her brain.
Yes.
And lastly, marry them young, illiterate, or old, but well educated.
Marry them young, illiterate.
I want you to break on that.
So there are educated illiterates. They may go to school, but school have not gone through them. When you marry them young, they're also still coachable and you can work with them. You guys can learn to know each other. When they're already old and educated, they come with baggages. And you already have a full life and now you want them to conform to your life. That's when they start labeling you. So pick them young. And when you pick them young, you are actually getting riches. They still have their fresh eggs. Everything is still to their advantage.
Father, if you could tell every man one truth about their body, what will it be?
One truth about your body is that nothing is permanent. So, for example, when they say, oh, that man has low sperm count, that's a lie. Tomorrow, your body can produce. You can produce more numbers. So everything that you've been dealing with, you can correct it.
So there's nothing like somebody, they say, permanently low sperm count?
I'm yet to see that. I always tell you that your body and my body, as we're sitting
That's
now.
what they call oospermia now.
Yeah, they call oligospermia, they call azoospermia.
Oospermia, yes.
Yes. The day you go for that SFA, that seminal fluid analysis, will determine everything you've been doing around that day will determine how much you're going to produce. There are rare cases where they have tumor in their brain or where their pituitary is not sending signal. But if that one is excluded, almost every man can produce sperm.
So any man that they said that there's medicine-wise, they said this person you cannot reproduce again. It can be corrected.
It can be corrected, and they should get a second opinion.
But why would I see some people will go online and they will say they have a doctor's report that maybe one sickness like disease, whatever, has killed their sperm and they cannot produce again?
No. So there is in the past, Nigeria, we used to have a disease called like mumps, which can affect your testicle. So it's called orchitis. Or you may have rare cases of a man with tumor in his pituitary. The pituitary is the master hormone, is the mother of all hormone. It sends signal to your testicle to produce. So if that is the case, we can see that. The majority, I have seen somebody that they said is azoospermia and he has triplets. It's all about getting to the right doctor. So trust me, your body, if I catch you on a day you are stressed, where all your businesses are not doing well, you are waiting for this and they make you make sperm that day, you're not going to produce enough. But if I catch you on vacation, where everything has been going well, you meet your G, everything is fine and everything, and they give you a variety woman, you go just the bang, your body go to produce like say you are on something. So that's why it's very dynamic.
So there's nothing like permanent infertility for men?
No. Almost in almost cases, just go and get a second opinion.
Except maybe you cut off your this thing. Except you
even men with one testicle, they still have babies. Unless you have things like that chronic orchitis or you have testicular problem or pituitary adenoma.
Except you cut. There's one thing that they say some men can do to stop production. They can be having sex.
No, like vasectomy.
Vasectomy.
Yes, you can do that. So that doesn't mean that you are infertile. You are producing, but they cut off your production line, your logistics.
It can be reversed.
Yeah, it can be reversed now. Your factory is in Abeokuta, but your market is Oshodi. And MC Oluomo said you cannot get to Oshodi because he doesn't like you. If he changes his mind and he likes you, you can get to Oshodi now.
What would be your final advice to Nigerians and to men generally?
No, to men generally, because, health is a form of wealth. That's what Ralph Emerson, the American philosopher, that's what he said. So whatever we do, we should learn to take care of our health. And to our men, I'm not saying you should be selfish. I want us to be more self-aware. African men and Nigerian men in general, we don't go to the doctors. Our ego is in the way. Our level of knowledge about our health is less than appalling. Let's be more aware. Let us be our brother's keeper. Call up me and check up on me. How are you doing, doc? And let me check up on you. Because we don't want to find out that I had mental health issues after I commit suicide. And what I'm going through, you may have the solution to it. I'm only 1 or 2 steps away from the solution to my problem. And the problem why I'm not getting it is because we're not collaborating. I should not see you as a competitor. You are my brother. Why not let's collaborate? Let's do the same thing for our health. Women are usually more resourceful. If you talk to a woman, if she has one problem, she has already contacted 6, 7 of her friends, and they're going to get her to somewhere. Men don't do that. Why?
Is there something you may have in your head that you may want to sit down and ask?
Well, is sex important? Yes.
Yeah.
Sex is important. Sex is actually physiologic food for men. So don't let anybody, and it's not something that you should display to people. It's personal. But try to get your health in order. Sex is absolutely important, especially when you do love making.
Dr. Rashid Abassi.
It's always been my pleasure, man.
It's a pleasure.
It's always my pleasure.
This conversation is really, really bad.
No, I promise you, I'm coming to your studio. That's what my mind wants to hear. So I'm saying this on camera. Next time I'm coming to the studio.
No problem, sir.
No problem.
Thank you.
It's always a pleasure.
Sincerely appreciate this.
Thank you, bro.
Guys, we did part 1 of this. We went in detail in some of the things I didn't ask. If you want to watch that, if you haven't watched it, you can click here to watch it, or I will link it in the description. So thank my guest, Dr. Rashid Abassi, for this highly, highly impactful session. Health, they say, is wealth. So, and your body is not something you look out for when there's a problem. Yeah. You need to look out for it every day. Absolutely. So thank my guest again, Dr. Rashid Abassi, for this highly impactful session. I remain your very host, Benzik. If you find this valuable, share it with as many as possible that this will highly impact. If you have been watching and you're yet to subscribe, the data says many that have been watching haven't subscribed. Hit the subscribe button, like this video, share it to those who will find it valuable. Maybe you can tell them to subscribe. They will hear from you.
Absolutely. Please subscribe. This is, tremendous information. And we know that when men and women have the right data, they make a good decision.
Thank you. So if you didn't hear me, at least maybe you heard the doctor, subscribe and share this video with those who will find it valuable. So to see the part 1, click here and you watch it. Thanks for watching, and I will see you again next time. Cheers.
Thank you so much.